The FLAME conference, in case you're wondering, stands for Family, Leadership, Affirming Marriage, and Employment. And so today we'll be talking about different sectors, different areas of this, and we'll be talking about it more in depth. We'll have breakout sessions. It's going to be a great time, and I hope you all are ready for it. And so FLAME, just a little bit of background of what it's all about. It's an initiative of the Office of Family Assistance, OFA, under the U.S. Department of Health and Human Services, Administration for Children and Families. It aims to promote and advance father engagement efforts across the nation. And FLAME, again, stands for Family, Leadership, Affirming Marriage, and Employment. And so we are Fathers Matters, and we are all about fatherhood. I like to say that we talk about fatherhood, what it could be, should be, what it ain't, what it is, and what it's supposed to be. And so we've been doing this work now since 2018, engaging fathers in this conversation about fatherhood, uplifting them, promoting them, and talking about all the good things that fathers are doing, because we know that there is an idea out there that fathers are aloof. I think of Homer Simpson, where he doesn't know what's going on and he just kind of lost and just trying to figure it out on the fly. But rather what we do is we talk about the fathers who are actually out there doing the work, engaged in their families, engaged with their kids, and they're not really being talked about. And so what we're doing is we're providing a platform for them. And so again, thank you all for coming out, being a part of this conversation. I'd like to pass it over to Mr. Farron Clark now.
Good morning. It's great to be a part of focusing Fatherhood FLAME. It's just a great thing to be a part of this. I'm the coordinator of a Black male retention program at Nicholls State University, my alma mater, and I'll be emceeing for today. It's great to be a part of this thing. When we talk about fathers, you know, every father is a son. Everyone has someone that they look to or hope to look to help them to the next stage. And so this conference is focused on various aspects of fatherhood, effective fatherhood, and branching out to people, providers who seek to engage and provide effective outlets for understanding and becoming better fathers. So welcome everybody. I'd like to introduce the first of our two speakers for the welcome Igniting the Fatherhood Flame. The first speaker is Dr. Armand Perry, Professor, BWSW, Program Director at the University of Louisville. So everyone, welcome Dr. Armand Perry.
Thanks for that introduction. My charge here is to talk a little bit about fatherhood and the role and the impact of fathers, so as to provide some context or set the stage for the good work that we are going to receive later on in this session. So if I can, I'll go into screen share mode. I think it may require that whoever is sharing, stop sharing in order for me to be able to share my screen. Fathers Matter, FLAME Community Conversations is what we're. So the first thing I want to do is just sort of, again, provide a backdrop for where we are as it relates to fatherhood. We know that in the last 30 to 40, 50 years, there's been a decrease in what many would call traditional family forms. And by traditional family forms, I'm talking about things like nuclear, married, two-parent households. For any number of reasons, we're seeing fewer and fewer families who represent that sort of a family constellation. We know that during that same time, we've seen an increase in non-marital childbirths, and we know that this is more pronounced with low-income families and also racial and ethnic minority families. There's some reasons for that we'll get into in a few minutes as well. Similarly, we've seen increases in multiple partner fertility. That's just the idea that sometimes people have children with more than one co-parenting partner. And as a consequence of all of those things, there's a body of research that suggests that fatherhood is sort of being conceptualized as a new package deal. And with that, what that means is that more is required of men than has ever been required for them in order to achieve the title of a good dad, right? So in days gone by, simply being a financial provider, maybe a protector, a disciplinarian was all that was required for people to be identified or labeled as a good father. But now we know that for any number of reasons, dads are expected to engage not only in traditional behaviors like financial provision and breadwinning, but they're also expected to be more involved in nurturing and caregiving. And so there is a new set of expectations for dads as it relates to what it is that society is looking for from them. At the same time, it has become more and more difficult for men to fulfill some of those traditional roles. And so, again, we live in some interesting times around fatherhood in that we're expecting more of dads at the same time when fewer and fewer resources and fewer supports are made available to them. Some of the factors influencing and impacting father involvement, probably the biggest one is macroeconomics. We know that in days gone by, in order for dads to fulfill that provider role, even dads who were low and semi-skilled men with not a lot of formal education could oftentimes find gainful employment in manufacturing plants. But unfortunately, many political decisions have led to a circumstance where goods producing and manufacturing work has been outsourced overseas, leaving behind fewer opportunities for low and semi-skilled men to be able to earn gainful employment, wages that used to be able to help them provide for their families. Those days, in many ways, are behind us, and that has led to many of the changes that we've seen in the family formation, particularly in low-income and racial and ethnic minority families. We know that public policy plays a role in the extent to which dads are able to play active roles in their children's lives. Things like child support policy, where we've seen increasingly punitive policies over the years, while at the same time not seeing similar types of federal guidelines around visitation policy and things along those lines have led to a circumstance where through public policy, we've reinforced the idea that dads have a financial obligation to their children, but we've not, through policy anyway, reinforced the idea or supported the idea that dads should be positioned to take active roles in their children's lives. So there's a little bit of a disconnect there. Social service systems play a role in this. Traditionally, social service systems have been the domain of women and children. The conferences like this give us hope and optimism that we're starting to see some of those changes, but it still remains the case that many social service systems and agencies are reluctant to engage dads. This is even more so the case when we're talking about, again, racial and ethnic minorities, particularly African-American dads. Oftentimes there is a lack of awareness and a lack of training that makes people reluctant and ineffective in their attempts to engage African-American fathers. And so we know that the social service system has a role to play in either supporting and facilitating or truncating and serving as a barrier to dads taking active roles in their children's lives. We've talked a lot about family structure already and the changing sort of demographics there, so I won't spend much time there. And family of origin and paternal identity, I think Darryl was mentioning a few minutes ago that every father is also a son. And so there's a narrative, there's a history, there's a socialization that happens in our families of origin, and those things shape us in many ways as it relates to our paternal identities and our paternal behaviors. And so many dads that we work with sometimes struggle with the reality that they themselves do not have active fathers, and they sometimes have difficulty moving beyond what it is that they have not seen because they've not had models. And sometimes we have to exhibit and demonstrate a little bit more patience to help them move through some of those challenges. And as I would imagine, many of you all are becoming more and more familiar with the issue of trauma and trauma-informed care, right? So one of the important things here is that we begin to move away from questions like, what's wrong with you, and start asking questions like, well, what has happened to you, in response to the increasing understanding that people are being negatively impacted by having been exposed to any number of traumas, either in their family of origins or in their communities, and these things having implications for their roles as fathers. So just a few quick things here. Again, we know from a social service standpoint, and some of this we've touched on, this is just sort of a reinforcement. Fathers are oftentimes seen as marginal and not directly relevant as it relates to child welfare work. We know that in many cases and instances, this was also the case for me when I was a CPS worker, we regularly remove children from their families of origin with very little connection or interaction with the children's father. As a consequence, dads again got pushed even further to the margins of their children's lives. And as we've already alluded to, there's a body of research supporting the idea that social service providers are oftentimes reluctant to engage fathers, even when there is no risk for abuse. We know that although there's relatively little known about engaging men, we do know that best practices suggest that we need to start engaging them early on, because early involvement is a predictor of subsequent involvement. And that when we're working with dads, it's not the same as working with moms. And so we need not try to take on a one-size-fits-all approach, but indeed we need to tailor our approaches that are specifically designed for men, because we know that men tend to parent differently. Again, that's not to suggest that all men and all fathers are the same, but it's certainly the case that, and research supports the idea that the ways that most fathers engage their children is different than the way that moms do. And as a consequence of that, if we're looking to intervene with the family, we can't just take approaches that were developed with moms in mind and then try to make those work for fathers. We sometimes get into disconnects there, and that's what this last bullet point mentions, which is the idea of sometimes programs make the mistake of engaging in work where their interest is in having dads engage in their programs, but dads are involved in their children's lives in other ways, right? And if we're measuring from a research and evaluation standpoint, measuring program involvement, we may be missing father involvement if dads are involved in ways that are different than the way that the programs are measuring involvement. So that's something for us to keep in mind. We know that dads play a big role in shaping children from a human development standpoint. Again, as we've alluded to, prenatal involvement is a significant predictor of postnatal involvement. So getting dads involved as early on as is possible, prenatal visits, well baby checkups, and things of that nature. All of those are good ways to get the ball rolling and develop some momentum around paternal involvement. We should be focusing more on the quantity of father's involvement rather than the quality. That's a byproduct of the limitation of the research measures that we have. We're looking for things that are easily quantifiable, so we concern ourselves with how many days a week a child is with their dad, or how often it is that the child sees the dad. And we spend much less time thinking about the quality of that involvement. We need to become more sophisticated in our measurements so that we can have a better handle on the quality of the involvement, as opposed to simply and exclusively being concerned with the quantity. Some of the other reasons why fathers are important is because we know that there's a body of research from a human development standpoint that suggests that fathers play a unique role in shaping their children's language development, cognitive development, social development, even emotional development. And one of the biggest ways is father's involvement helps to promote children's confidence and risk-taking behavior. And risk-taking not from a safety standpoint, but being willing to step out and take chances and explore the world around them. And those are things that, when mastered, help to promote children's confidence. And there's a body of research suggesting that dads play a heavy role in helping children develop in those types of ways. So that's something for us to be thoughtful and mindful of. It's tough to talk fatherhood without talking co-parenting, especially given the demographics of our families in the way that we were talking when we first opened up, in terms of decreases in marriage and increases in non-marital childbearing. And so from a co-parenting standpoint, there's a body of research that points to the fact that if we can combine maternal encouragement and facilitation with father engagement, what that produces is what I call a virtuous cycle of co-parenting relationship quality, where moms are encouraging dads to be involved. And when dads take those opportunities, what happens is it sort of continuously develops a cycle of more and more encouragement, which begets more and more involvement, which is related to the idea of fathers taking on more and more of the nurturing and caregiving responsibilities, which reduces maternal parenting stress. And all of those things support positive and engaged parenting from both mothers and fathers. And so right before I end, again, as a social work practitioner, I like to be solutions focused and like to bring practical and tangible tips and strategies to any presentation or talk that I do. And so I would leave you with just a couple of recommendations for agencies and practitioners. One thing we want to do is we want to be mindful about our attitudes and our biases. Again, if we've been trained and socialized here in the United States, it's likely that we've been trained and socialized in a context that suggests that fathers are less important parents and mothers, and we know that that's not the case. Dads are equally important for all the reasons that we've already mentioned. I think it's important for our agencies to assess their father friendliness from a physical standpoint, from a policy standpoint, from a procedure standpoint, from an intervention standpoint. Take a look at ourselves and reflect on the work that we're doing and make some determination as to whether or not we are creating atmospheres or environments that are conducive to having dads in and around the space. Similarly, it's important for us to take on the attitudes that dads are fathers and are assets and can make positive contributions to not only their families, but also their communities. Doing that through being committed to engaging fathers and also doing things like we're doing here with this Flame Conference, which is about collaboration and partnership with agencies across, in some cases, the local environment, but in other cases, nationally and even internationally. How is it that we can learn with and from one another so as to put ourselves in the best possible situation? That is most of what I have, but I did want to share with you a few other fatherhood resources, and there are resources on these websites for practitioners, uh, administrators, but also just dads in the community, right? So at all levels, there are resources available on these websites: the Fatherhood and Research Practice Network, the National Responsible Fatherhood Clearinghouse, the National Fatherhood Initiative. For those of us who have smaller children, ages of 0 to 3, again, all about getting off to that good start, having dads play an integral role in their children's development. That is my time. I'd be glad to continue the conversation. And if you are interested in connecting with me around any of this work, that is how you get a hold of me. My email address is there, as well as a telephone number. I'd be glad to have a discussion, a conversation from a follow-up or collaboration and partnership standpoint. I really appreciate the opportunity to be here, and I hope you all have a really, really good conference. Thank you all so much.
Thank you very much, Dr. Armand Perry, for those insightful words. We appreciate the energy and the insight that you bring to us, and reach out to Dr. Perry for more information on what he shared. Thank you for making yourself available to that. How's everybody doing? How about we start with this? What if anything, if you could tell, maybe we could send it to the chat. If you could tell, and this is open to any and everybody, all right, in the chat, if you could give some advice that you've learned or that you are learning about fatherhood that maybe some people may not know right off, maybe it was a surprise to you, just go ahead and put that in the chat, and we'll talk about that for a little bit before we get into our next presenter, Dr. Ken Harris. So once again, thank you, Dr. Armand Perry from the University of Louisville. So what if you could say one piece of advice or one thing you've learned, go ahead and put that into the chat, or we can just start a conversation right now. So we want to do that before. Let's see what we got in the chat, or if anybody wants to tap in and share. All right, so Mr. Bob Letcher says, give men a voice. Yes, a voice. Voice is very powerful. Voice is very necessary. As everybody's a listener, we can hear, but what are we listening to? What are we taking in? Thank you, Bob Letcher. Jared Hall says, I was surprised that fathers that are seeking out help rarely hear someone tell them that they are proud of them, right? That affirmation is so important. All right, so thank you, man. These are some great responses. Thank you, Dr. Perry. Thank you, Dr. Perry. We'll go with one more. Robin Grunfeld says, this may be this may have been a no-brainer, but I love hearing that prenatal engagement is a predictor of future engagement. Interesting, interesting. Thank you. It's a predictor. Fathers matter. Daryl Creasy says fathers matter in all stages of life, for the family at large, for the kids, and for the mom. Bob says, affirm, approve, and celebrate is what I tell my men. The affirmation is so important, as we just heard. Dawn Collins says, I am a doula and see that firsthand at Robin. So thank y'all very much. So we'll continue on. I apologize that I skipped the overview, the agenda, the welcome, igniting, that's at 10 a.m. The Fatherhood Flame, and the 10:35 session, kindling the flame barriers. Well, we're gonna break around at 11:15. Thank you very much. And at 11:20, we'll continue with session 2, kindling the flame opportunities. Kindling the flame of fatherhood involvements, opportunities. The presenter and facilitator will be Dr. Latrice Rollins, Assistant Professor, Morehouse. So we'll continue on from where we are. I appreciate everybody's patience and participation at this wonderful event. So we'll move to our next speaker at the first part of this Focusing the Fatherhood Flame conference. Our next speaker is Dr. Ken Harris. He is the Vice President of Community Engagement at the Community Foundation and the Director of the New Haven Federal Healthy Start Program. So at this time, Dr. Ken Harris.
Oh, good morning, everyone. So quick correction. So I am not doctor, so I want to make that correction. That's Ken Harris, and I'm actually no longer with the Community Foundation. I'm actually an executive project director and engagement lead for the National Institutes for Children's Health Quality, which is called NICH.
Thank you so much for that correction.
And here at NICU, we're based in Boston, and we're a national organization, and we manage the Healthy Start TA and Support Center, supporting the 101 Healthy Start grantees around the country. So that's kind of where I am, and just wanted to make that clarification. I'm very happy to be with you all, and just to take a few minutes just to welcome you all for this conference and hopefully inspire you all to talk about just the impact that fathers can have on families and communities. And that's really what our nation work is up to when it comes to fatherhood in the 21st century. It's really talking about fatherhood and fathers in context to their families and to communities. Not only are fathers good, we're good for family, but it's also important to acknowledge the role that we play in community. And all of your organizations that are represented here are about supporting our families and their communities. And so I want to share. I only have a couple of minutes, so if I do that, if that's all right. Okay, one moment. Are you able to see my screen?
Yes.
All right. So really what I encourage us is you all continue this conference, and thank you, Dr. Perry, as well, but really lifting up fathers and telling the stories of fathers. And each of you have those stories, and our moms have the stories, our folks that have been working with families have those stories. So really story fortifying. And you want to talk about igniting a flame. You want the desire for fatherhood and increase the passion for fatherhood. And this action of fatherhood work, all of us play a role in that, and really lifting up those stories of fathers. And so I call that story fortifying. And so the inclusion of fathers and partners with our moms and birthing people. Today, we're looking at fatherhood in the MCH context, maternal and child health. And so we don't need to change the name of maternal and child health, but really starting to talk about and show how fathers really play a role in supporting and encouraging our moms and leading to greater birth better birth outcomes. And with regards to infant mortality and maternal mortality, our role in supporting our women and our children is important. So that's what this story about this fatherhood is, just really showing how we show up in the framework of maternal child health, as you've heard in the previous presentation. And so this journey of inclusion in our work is really important. How do we include dads in these conversations, in these programs? And it's important to understand that there was a history of exclusion. So those that have been doing this work for a while, just build on what you've learned. There was intentional exclusion. So you look at policies that really prevent men from being involved or fathers from getting engaged. There's a history when you look in certain groups, certainly among African Americans, when you look at our Native Americans, there's a history in this country that lets us understand what exclusion was like. And so this journey toward exclusion is a tough journey, because you have to really move from exclusion and understanding where the segregation happens. And then how do we integrate fathers into the work? And then finally, the equity comes in when it's really total inclusion. And that's what we want to celebrate. We want to celebrate the work that you're doing. But remember, many systems were not even designed for him. So your work that you do today and tomorrow is so critical when it comes to including fathers in systems not designed for him. And that's where we want to look at equity in the system. So just looking back to leap forward, it's just important to understand father's story across a lifetime, right? We're talking about all fathers here, even though we really lift up African American and American Indian, Alaska Native, and Hispanic fathers when it comes to these disparities. It's important to understand that our Maternal Child Health Bureau of this country has made a commitment to fatherhood. And while the MCH, Maternal Child Health, is 100 years old, fatherhood work has really been just 30 years old. And so we're already behind. And so again, lifting up these stories is important. So when you think about the history of maternal child health, of working with our women and children, where have fathers been along that timeline? It's very important. And again, when you think of the impact of slavery on both family formation, it's important to keep that in mind. And that helps us understand the struggle to getting to where we need to today. And when you look at our American Indian population, again, we understand the struggle with those families. And so men were rendered invisible at one time. Fathers were invisible, right? And so we're making him visible. And that's part of what the 21st century fatherhood work is about. And that's what the flame is about. And I'm feeling that the flame is like important to be on fire about this. So really lifting up fathers as we move forward into this work and continue this work, doing it in an age of mass incarceration. And so that's our backdrop. And then where you are, it's important to understand that context, because 95% of men incarcerated happen to be fathers. And so we need you all to be those inclusion champions, to lift up the stories of fathers, to talk about that positive impact on family, positive impact on community, and really talk about how do we prepare our community to even receive our men and fathers back, and how we support them even when they come back, and so they don't have to be crushed under the shadow of probation or parole. Really, how do we support our fathers again as we do this work? And so my encouragement to you throughout this conference is just to remember the challenges that we have, but certainly stay passionate about what you're doing and let that flame just take that to where you're going, and set other things on fire for fatherhood. And that's fanning the flame of fatherhood, and looking at those systems, as you've heard, that prevented him from being involved, and then think about how do we connect fathers. And so I think this conference is terrific, and it's important that we all understand and get on the same page, but that we all begin to lift up those stories. How do we remove those barriers for fathers? How do we become inclusion champions and really bring our fathers together and show the positive impact that and fathers have on families and our communities? And that is my encouragement for you, to let the fire burn strong, and certainly to light it up, as they say. So I thank you for having me, Daryl, all my colleagues there. I appreciate just an opportunity to come and say hey and encourage you all. I'm inspired by the work that you all are doing. I'm inspired by today's conference, and I hope that you all have a terrific day. Thanks so much for having me.
Thank you so much, Ken Harris, for those words. It's very insightful. That the U.S. incarcerates 716 of every 100,000 residents. Wow. Those numbers are startling. And so is the passion and the insight that you gave us through your presentation. And sorry that the time was a little pressed. We pulled a lot from what you shared. And we appreciate you. So y'all feel free to share those appreciation comments in our chat. So thank you very much, Ken Harris. Appreciate you. Just a little housekeeping, just to remind, if you know, if you have to take care of something, feel free to just make sure you have your, if you have to move with your camera, you can mute your camera and you can mute the mic as well. Thank y'all so much for being here, a part of this amazing conference, focusing the fatherhood flame. Yes, a beautiful and wonderful presentation. So now we're at the point where at our first session, our breakout session, Kindle the Flame of Fatherhood Involvement, Barriers. The presenter and facilitator is Dr. Tasha Alston. She is Chief Diversity and Inclusion Officer at the University of Pittsburgh at Bradford. So everybody, welcome Dr. Tasha Alston.
Let's see, my computer's going a little slow, so just bear with me. Can you see my slides? Yes, can everyone see the slides?
Yes.
Okay, thank you. So again, good morning, everyone. Thank you for allowing me to join you today. My name is Dr. Tasha Alston. I am the Chief Diversity and Inclusion Officer at the University of Pittsburgh at Bradford. And to give you a little context, again, I want to first thank Fathers Matters, Compassion Outreach of America, and I thank Dr. Gross also for inviting me to present at this presentation. So as it relates to my work in fatherhood and father engagement, I have 24 years of experience, I would say, in working with not only fathers, but also culturally diverse communities and families. I'm providing you with the context so that you can see how I move through and navigated towards the important work of fathers. As a social worker and as an educational psychologist, I started off working in culturally diverse communities with families. And what I saw in that work is that fathers weren't being included in the work of families and the work of strengthening families. And this was in the early 90s. What I also noticed was that fathers were very much involved in the lives of their children, but there was no outreach, there was no engagement, there was no involvement in the work or the treatment plans. And there were no resources provided for fathers that were also provided with mothers. Through that work, what I also saw was that as we were strengthening families and not including fathers, and working with families, we're also working with children. And it was important to, in working with children, to help children also achieve their goals through education. And so that's where the education component came in, because it was important for me to also understand research and education to support children, with their educational goals, but also to support families as well. So collectively, through the work of working in communities, it was important for me to begin to identify ways to challenge the narrative, of fathers not being involved. We know that with fathers, especially African-American fathers, they are the most involved fathers. However, there's a myth in the narrative that indicates that African-American fathers were not involved. And so I wanted to work towards challenging and changing the narrative, but also work towards social justice and color by uplifting families of color. So we know that as it relates to education and working with families, especially fathers, the education positively affects the lives of children and families. We also know that education is a utility vehicle. Therefore, the work that I do works towards challenging the master deficient narrative that exists and unfortunately persists on African-American fathers, although that narrative is now changing, and to challenge and change the narrative as it relates to African-American fathers. When we think of barriers, especially barriers in the literature and perspectives, we know that the literature is improving. However, regardless of class, African-American fathers don't have a voice in the literature on parental involvement. And so when we think of barriers, this is a barrier. the fact that African-American fathers, who are the most involved, very much involved beyond all other father groups, do not have a voice in the literature. Their voice is often silenced, marginalized, or muted, and not included. This is a barrier. This information tells us that a gap exists in literature, and in parental involvement not only has a gap, but it also has a racial and gender bias that favors the involvement of mothers and also white middle-class fathers. Therefore, the involvement that fathers have, specifically African-American fathers, is often marginalized. And this too is a barrier. In addition, the literature largely portrays African-American fathers from a deficit perspective that portrays African-American fathers as missing, not involved in peripheral in the lives of their children's personal and educational lives. Again, this is a myth. We know that through the research that and I'll speak about it later, that African-American fathers are the most involved fathers. So we know through the barriers that I've mentioned that there's a need to privilege the voice of African-American fathers through their own stories to understand their involvement and to understand their perspectives of involvement. So one way to close the gap, if you saw earlier, I recently have a book out. It's African-American Fathers' Involvement in Their Education. And this book closes the gap by giving voice to African-American fathers. You hear about fathers through their own experience, their own perspectives, to their own stories. It also unapologetically focuses on the contributions that African-American fathers make in their children's personal and educational lives. This is important, again, because when we think about challenging that deficient narrative and changing that deficient narrative, it's important to tell what the real story is. And the real story is that African-American fathers are engaged, involved, and want to be involved. And so this book unapologetically and purposefully gives voice to African-American fathers and unapologetically places race in the forefront of the research. As indicated earlier, when you're talking about identities, we must talk about the full identities of African-American fathers. And we understand that race is not only putting race in the forefront, not only values, validates, and respects the full identities of African-American fathers, but we also have to examine the context of how race affects African-American fathers as a father. Ways to overcome barriers are through being unapologetic. Again, be unapologetic in acknowledging the contributions that African-American fathers make in their children's education. Challenge the deficient narrative. Again, African-American fathers are the most involved fathers. And so it's important to make sure that that research is known and to make sure that in the work that we do, that we're challenging the narrative and also saying what the true narrative is. And as Dr. Perry indicated earlier, acknowledge the contributions that African-American fathers make, not only in the lives of their children and families, but also in their communities as well. And through those contributions, talk about the complex environment, complexity as it relates to the lives of African-American fathers, because through that narrative, we can work to humanize African-American fathers, because again, the narrative and the images in the media are so deficient. We have to find ways to overcome that narrative and overcome those images. And so again, by acknowledging the contributions and really saying the true involvement that African-American fathers have. Again, related to the research, when I say African-American fathers are more involved, and here's the research. So in 2011, McFadden, Thomas, Lamunda, and Cabrera indicated that African-American fathers are more involved than both Latino fathers and their white counterparts. So for example, African-American fathers have the highest number of involvement at 90%, with Latino being next at 79%. I'm sorry, African-American fathers are 82%, and white fathers coming in last. So this research is pivotal because it collectively tells us through the research that African-American fathers are the most involved fathers. Hence, this research challenges the master deficient narrative, and it also tells what it really is that African-American fathers are the most involved fathers to counter and challenge that myth. We must understand when we think about overcoming barriers, the importance of value, validating, and respecting the involvement that African-American fathers have. The involvement that African-American fathers have does not look like white middle-class standards of involvement or the white middle-class standards of involvement that educators prefer. So in other words, African-American fathers are involved, but not in the school environment. They're involved outside of the school environment primarily. Educators prefer engagement that happens within the context of schools. And so it's important to have wider and more diverse perspectives of involvement. And it's important to understand that the involvement and perspectives of involvement that African-American fathers and African-American families have is still important. And it's important to include the role of culture and when you're looking at involvement. And so there is a need for researchers to not only have broader perspectives of involvement, but also to understand the role of culture and how culture affects fathers, specifically African-American fathers of involvement, and to understand that white middle-class standards of involvement that educators prefer does not apply to African-American families, especially African-American fathers. When we think of overcoming barriers in the context, Connor and White spoke of this, the importance of examining the context, and suggested that actions, decisions, responses, and behaviors of fathers all take place within a cultural, historical, political, and environmental context. And the context must be examined to understand how these contextual factors affect Black fathers as they father. So again, context as important. Therefore, not including race and culture creates further racial and cultural hierarchies that are already in American society, and it ensures that the full identities of, if we include race and culture, it ensures that the full identities of African-American fathers are valued, validated, and respected. And so we must be unapologetic in talking about and discussing race. I won't talk about this study because I just talked about it. Again, the research indicates and says that African-American fathers are the most involved fathers. Also, when you think of additional research, Leidy and McHenry in 2006 indicated that African-American fathers have higher levels of involvement, higher probabilities of living near their children, spending more time caring for their children, higher levels of involvement in childhood decisions, and higher levels of involvement of living nearby their child than non-Black fathers. This information that I provided you with is important because one, it informs you of the importance of African-American fathers, not only in the lives of their children and families, but the importance of understanding that African-American fathers are actually the most involved fathers. And therefore, it's important for us to push forward that narrative because that's the true narrative. And as we do the work of father engagement, of ensuring that we acknowledge the contributions that African-American fathers make, and that we also value, validate, and respect the involvement that African-American fathers have, and appreciate the contributions that fathers make, but also their involvement as they uplift our African-American communities. So right now, we're actually going to go into our breakout room. I'm going to stop sharing the screen. We are going to do an activity now based on barriers. What that activity will entail is for about 10 minutes, you'll have discussions in the breakout rooms of what supports healthy father involvement, why members of the community hesitate to engage in fathers. So have the discussion. After you have the discussion, we'll come back to the main room and we will collectively share the information together. We had the discussion and we had excellent discussions based on some of the barriers that persist related to what gets in the way of supporting healthy father involvement. Also, why might community members hesitate? Can you share some of the discussions that you had or some of the things that you discussed in your groups?
This is great.
Oh, okay.
Sorry, go ahead, Darryl.
Nah. Age before beauty, man. Age before beauty.
All right, I was still gonna go second, but yeah, we're in group 3. And these gentlemen, like say, Kevin, Jared, and Garrick, man, they started straight off. You know, it was a stigma. They're, like I say, trying to get through that stigma of help, like I said, we're supporting fathers. We are doing the things we're supposed to be doing, but getting past that stigma. And they were using examples from the birth process and to just going to doctor's appointments. And the main concept or the main thing that flowed from that was at what point are we allowed to basically to stop compromising? So it was a question to be answered at a later point, but that actually was a barrier, because we don't know. Like I said, we go in, we got to put on the persona of trying not to be who we are in front of somebody that should respect us for who we are. So the term that we couldn't find the right one word for it, but even just sitting there, it's like, if you take, like I said, one of the examples, one of the brothers stated, like, I took my kid to the doctor's appointment, they asked me, where was mom? Like I say, just, I'm here, I'm with the kid, it's the appointment time. What does that have to do with the color of the Kool-Aid? So, and I'm on the paperwork, like I say, so I shows that I should be able to do this. But those were, like I said, that stigma that is there, and the compassion or the compromising, like say, and they want you to be angry and do these things, but we want to be here. We just want to go in about our day doing the regular things we're supposed to be as fathers. So it was mainly about the healthcare industry and how we're treated and not being considered, okay, we're a parent that's here for our kids.
Absolutely. Thank you. You make an excellent point. And what you're speaking to is the importance of ensuring that there are father-friendly environments and ensuring that the same resources that are provided to mothers, the same equitable resources and the same equitable treatment that is provided to mothers is also provided to fathers. And so again, speaking to the importance of father-friendly environments and making sure that the resources and the treatment is equitable with fathers. Absolutely. Thank you. Other thoughts? And you can address any of the discussion questions. Other thoughts that you had in your group, or other discussions you had in your group?
Go for it, Daryl.
Thank you. So the barriers that were lifted up in my group, Dr. Perry started off with mentioning that the policy arena is ripe for intervention. And he also lifted up how folks are not knowledgeable of how policy works, and used child support as an example of dads sending money to the state taking their money, mom doesn't get it, and then it triggers a distrust between dad and mom because the state is in the mix of taking money where mom is not getting it, dad thinks she is, and now it's a conflict. Ms. Washington also lifted up that there are way more services for women than men, and then that Black men in particular, have a barrier of incarceration. And she also added that we are not at the table of policy change, and that the incarceration also gives a psychological effect within the Black man's psyche to effectively parent their children. And then Mr. Holmes also mentioned through his personal experience that having a representative, if not your father in the home, a positive role model figure, male figure, is paramount to your understanding of what it means to be a dad. And he also lifted up the fact of a nurturing environment, the earlier the better, would be able to enable children to have better outcomes as they grow older. And Mr. Butcher, the last person who was in the breakout room along with Mr. Clark, they both, well, Mr. Butcher also lifted up that dad in the home is a big deal, and he he lifts up in his own work how to break the cycle of being taught how to not being taught how to be a dad. So yeah, we had
Excellent, thank
a very
you.
robust conversation.
It seems you had a very robust conversation. You touched on so many points. You talked about policies, the importance of making sure policies are equitable. You also talked about resources, again, and making sure that those resources are equitable and making sure that equity, when we talk about equity, fathers are provided with the exact same resources that mothers are provided with to help them have the resources they need to thrive and to be able to better support their children. Absolutely, thank you. So for the sake of time, we're going to go ahead and move on, and I'm going to close out. I do want to provide you with some ways to overcome barriers. So again, understand that African-American fathers play an important roles in the lives of their children, families, and communities. Value the contributions that African-American fathers make in the lives of their children and families. And as you do your work to challenge the master deficient narrative, because again, we know through the research and through what we see that African-American fathers are the most involved in fathers. African-American fathers are engaged and they want to be engaged. Be intentional about engaging fathers. Create father-friendly environments, practices, policies, and again, provide fathers with equitable resources and be open to diverse perspectives of involvement. When we think of culture and we think of race, we know that culture is foundational and is an uplift for African Americans and for people of color. And so you have to be open to diverse perspectives of involvement because culture plays such a huge role in the involvement that we have, but also in the involvement that African American fathers have as well. I want to provide you with this resource. Again, I recently have a book out. It's African American Fathers Involvement in Their Children's Education. If you use this code, you can get a 30% discount. So try to take a picture if you can. Again, you'll have a 30% discount. If you go to the website, you'll have to type in my name, Tasha Alston, to get to the book. But again, use this code so that you can get a discount. You can also order it. The website is roman.com in Lexington. And you can also get it at Barnes and Nobles, but at Barnes and Nobles, you won't be able to use the discount code. And so if you have any questions for me, I'll take questions now. Again, I wanted to be mindful of the time and mindful of the time we have together and the next speakers that will come after me. If you have any questions, you can feel free to contact me. My email address is tla42@pitt.edu. Again, tla42@pitt.edu. Thank you for allowing me to share this time with you. Thank you for the work that you do as you work to support fathers and father engagement and fatherhood work, because we know that fathers play a pivotal and important role in the lives of their children's families and communities. And it's important to continue to work to uplift fathers and, more importantly, to make sure that we challenge the narrative that exists, because we know that fathers are involved and we know that African-American fathers are most involved. And it's important to acknowledge the contributions that fathers make in the lives of their children and families. Thank you so much, and everyone have a great day. I'll see you in the next session.
Thank you so much, Dr. Tasha Alston. Very insightful, informative, and affirming for the crucial, critical role that fathers play. Thank you so much for sharing. Mr. Darrell Creasy, could you take some time to talk about Fathers Matters and what you do? And then following that, there's a video that speaking of ensuring the whole dad. This is a video by Jeff Johnson. So Darrell, could you take it away and talk about Fathers Matters?
Certainly. Thank you for giving me the floor. My name is Darrell Creasy, everyone. I am the program manager for Fathers Matter. What we do over here is what you see us on this line doing. We are doing lifting up father advocacy. Our normal means of transmission for father advocacy is weekly discussions, what we call dad discussions. And we'll be resuming those at the end of the month on March 31st. There's a flyer that's going around somewhere that we'll present later. And I just want to respect everyone's time and introduce this video. This video is very, very short, but it will give you some context to the next speaker. So feel free to get y'all some lunch. I hope you enjoy it and come back ready and re-energized to re-engage. Thank you for letting me share.
There was one great practitioner who said some time ago that when a father is not involved in a child's life, the assumption that you should have from the very beginning is that he wants to be there. And if you start from that premise, then you say, well, if he wants to be there and be engaged in the life of his child, what are the barriers that stand in the way of him doing that?
All right, welcome back, everybody. Hope y'all enjoyed your bio break. I see some folks got some beverages, some water, some coffee, some teas. There you go, water bottle going. So we'll be settling in a little bit, a couple of seconds. We'll be jumping back into it. So I'll pass it back to Mr. Farron Clark to take us.
Thank you, Bantu. All right, so in 2018, here at Nicholls State University, a program was formed to help Black men in their first year get the most out of their first year. Take it like running a mile, 4 laps. So we teamed them up with young men who's already kind of been at Nicholls for a minute, Black male upperclassmen who want to see them win in their first lap, the first year. So after the first year of Crown, Colonel's Retention of Winners Network, not only has the numbers increased, but we created a breeding ground for success, a literal and figurative lane for young men to do what they envision themselves doing. The reason they came to college. Nobody comes to college to fail. So Colonel's Retention of Winners Network is in its 4th year, and not only has the numbers increased, and we know that all colleges have retention focuses, but we have more of a voice here. It was mentioned earlier by a number of you all, a number of us, that it's important for us to hear and also listen to the voices. So Crown is a roadmap of success for Black men here at Nicholls, mainly Black men who are not student athletes. We're excited about having people like Fathers Matters join us on a Zoom call, which we did last spring. We had a great conversation with the number of mentees and mentors, just Black men talking about various things that we're often told, this is not the space for that. Why are you bringing that anger to the situation? So it's a literal lane, and we look forward to expanding and climbing and flying in our lanes. In this brotherhood, every king wears a crown. The young men in the first year, they created their own motto for what they want Crown to be. And on Tuesday, the 15th of March, we have what's called Give In Day. It's the day of giving. I'll drop that. Well, you can go to the Crown folder and you can find out more information. If you want to financially support Crown, this has just been a wonderful space to do that. So I'll transition to the floor to one of our mentors who, while in his first year here, he was a mentee, but he's been an encouragement and a mentor to everybody, speaking and listening, and just a humble spirit. His name is Channing Holmes, and Channing is from LaPlace, Louisiana. He's a junior in mass communication, and he's got some poetry that at this time he's going to share. So he's going to, so Channing, thank you very much for being here.
Thank you, Mr. Clark. I appreciate that welcome. And I just want to give you a shout out right now. You've been a real mentor to me and a father figure to me because, you know, when I first got here, I was kind of uncomfortable about coming into a PWI. But when you told me about Crown and when I first joined, and you were always there for me when I needed something, you were there for me as a mentor and a father figure. So I appreciate you for that. Good morning to all y'all. thank you for allowing me to be here and express my words and my different perspectives. Thank you to everyone who's spoken so far and everybody who's here in the meeting. I think this discussion about fatherhood is very important because fathers are important in society. I've had a lot of father figures in my life. Um, like I mentioned in the break room, my father wasn't in my life as much as I wanted him to, but thankfully God blessed me with a few father figures in my life, and they've shaped me into the man I am today. So I don't want to take too much of y'all's time. I do have work in a little bit, so once I finish this poem, I'll have to unfortunately leave. But I'd like to share this poem real quick with y'all. It's called A Father's Lasting Effect. And I made this poem yesterday and I finished it late last night. And it's basically about, a lot of times when we're assigned a job, the job description says that we have to do this, but in order for us to go above and beyond and to do the job as best as it can be done, we have to go outside the job description. So I'll go ahead. A father's lasting effect. The role of the father is simple: to provide and protect. But is that all a father can be? Can he have a lasting effect? Can a father be a role model despite his own past? Can a father teach his child how to shave? Can a father teach his child how to cut grass? You see, some fathers are not present. Their absence is loudly heard. Are you really surprised to see your child in the streets? Are you really surprised they couldn't get past third? You see, fathers are needed in our world to provide and to protect. But you see, fathers can do much more than that by creating a lasting effect. Thank y'all.
Thank you, Channing, for those words. Thank you for your spirit and willingness to generously share from your heart. Wish you the best with the rest of your day.
Thank you, Mr. Clark. And I would just like to let y'all know I do have a blog website that I started a couple months ago. I'll leave that in the chat before I head out. But I hope y'all have a good day, and thank y'all for allowing me to speak.
You're welcome. Thank you. Very touching. So as we move on, we'll move on into our second session. Thank you again for those words, Channing. Kindle the flame of fatherhood involvement, opportunities. The presenter and facilitator is Dr. Latrice Rollins, an assistant professor at Morehouse School of Medicine Prevention Research Center. So at this time, let's welcome Dr. Latrice Rollins.
Good morning. Good morning, everyone from Atlanta. Thank you for this invitation to present and facilitate this important conversation today. I am very cognizant of the time. I am before lunch, and so that means I'm not going to keep you long at all. I do lead several community-based research projects focused on increasing service provision to engagement with fathers. Also, my favorite saying about father engagement is similar to the Frank's hot sauce saying, I put that on everything. I use that saying because the research shows that whatever we are working in, when we add fathers, especially if we're working with children and families, when we add fathers and fathers are engaged, the outcomes are improved. And so as a social worker by education, we are trained to recognize the strengths of our clients as well as the strengths of our families. So echoing my fellow social worker, Dr. Perry, I see fathers as strengths and assets. And so this session around now taking those barriers that you identified and focusing on opportunities is just right up my lane. So assets are useful and they are valuable. If we are not engaging fathers, then that is a missed opportunity. Fathers are often underutilized resources in our efforts to improve child, family, and community outcomes. I was recently doing a workshop on father engagement with some School of Social Work students, and we talked about how their relationships with their fathers versus their mothers were different. There were opportunities where they, shared certain things with their fathers that they didn't share with their mothers. And so as practitioners, as providers, if we're not getting the full picture from both parents, we don't have a comprehensive, opportunity to act on information, that can really help our children if we're not asking both parents. So regarding community outcomes, my colleagues here in New Orleans did a report on the underutilized potential of African-American men to contribute here in New Orleans on the growth of the New Orleans economy. And so even in this pandemic, as tragic as it may seem in terms of exposing and increasing the existing disparities related to health, related to economy, related to racism, there have also been some great opportunities. So while I would have loved to be there with you all today in person, the ability to communicate and collaborate with you all using technology has been a great opportunity that has come out of this pandemic. Also in Georgia, the engagement of many of our fatherhood programs has increased during this time because, the barriers related to transportation, related to childcare and work schedules, those have kind of been addressed because fathers have been able to join in, even if they have issues with broadband internet access and things like that. They're able to get on their phone and call in and get in on some of the fatherhood meetings and have that chance to talk about their issues and access resources that they might not have been able to do had everything just been, in person. And so in our book, Engaging and Working with African-American Fathers, we conducted a study. There's a study that's covered in the book, actually, that talks about working with new and expecting fathers in New Orleans. And we found that fathers had no formal support from organizations that were, related to their parenting or other resources that would help them with their transition to fatherhood. And this is concerning because the research shows that pregnancy and immediately after are the best opportunities to engage fathers. That prenatal period or the time of pregnancy is called the golden opportunity. And that's a time where you can engage fathers. Also during the postpartum period or after delivery, that's called the magic moment. And so these are critical times for providers, for staff and researchers to engage expecting fathers or new fathers, because like mothers, they are particularly open to advice, open to support, and open to information. So despite the barriers, there are great opportunities to work with fathers to ensure that we help them, their children, their families, and their communities. So as you all have identified some of the barriers and some of the needs, it's also important to identify the assets, the strengths and opportunities in your community. When we implemented the community mobilization approach here in Atlanta, that's an approach that was developed and tailored by the National Fatherhood Initiative to promote and support father involvement. We conducted first a community needs and assets assessment. And so we, again, didn't just focus on what were some of the needs and some of the barriers, but turned to some of the assets. And that allowed us to ask fathers, community leaders, state and local government agencies, and other service providers about some of the existing programs and resources that existed in the community that actually served fathers or had some resources for fathers. And so this ensures that we're not duplicating efforts and that we are building on and maintaining resources in the community that are already working well. And so you may have also heard of the term asset mapping, which is a process for identifying and listing key services, benefits, and resources within the community. That can include individuals such as current subject matter experts in your community. It can include organizational resources, physical space, institutions, associations, a number of things that already exist in your community that can help to address some of the barriers that you have identified. Having done some fatherhood work with my colleagues in New Orleans, I know that you all have strong fathers, you have strong advocates, you have organizations that you can partner with to address the identified barriers. Many individuals and organizations in New Orleans are already supporting fathers and future fathers, including the organization sponsoring this conversation today, COA, the Fathers Matter program. You have the Silverback Society. You have Dads on Duty, which received national recognition for their efforts in the schools. And so as one of the reports on fathers in New Orleans states, supporting fathers is not the domain of just one or a few organizations, social service organizations, nonprofits, educational institutions, workforce development organizations, philanthropies, businesses, and policymakers all have an important role to play in engaging fathers, whether it be through ensuring services are father-friendly, teaching parenting skills, providing healthcare services for low-income fathers, offering job training in lieu of incarceration for fathers who are behind on child support, providing intensive employment assistance. These are all different ways that we can address the barriers together to better promote and support father involvement. When you identify these assets and think kind of out the box, working with others across in different sectors, getting out of your silos, to really identify all the different opportunities for cross collaborations that can truly serve and really help the children and families that you all are really trying to serve anyways. Everyone is trying to work with the same communities and all of those. If we come together, we're truly better together. You can also identify opportunities to address barriers by conducting a father-friendly assessment. I believe this was mentioned before in terms of how fathers feel when they go into certain places, whether it's a doctor's office or school, or even some of the agencies, social service agencies or health departments. But these father-friendly assessments are free. They're available online. They will help these agencies identify strategies within their leadership structure, within their policies, their procedures, with the need for staff training, any marketing and community engagement that needs to take place. These assessments will help to improve father friendliness. We have conducted the Father Friendly Checkup, again, which is done through the National Fatherhood Initiative. We've done that with maternal and child health programs here in Georgia, and it has helped them to come up with ideas and action plans to better serve the fathers. So reframing barriers, that is where we're going right now. And so that means, in other words, you have an opportunity to change the way you view the barriers in order to take action. And so I hope that this brief kind of context and background that I provided was helpful and kind of sparks your ideas and get your mind going about now how you can come up with some opportunities to address some of the barriers. So I'm going to, if you have any questions for me or you have anything that you want to share in the chat, you can do that. I am going to pull up the slides to really introduce the activity that you all will be doing for the next couple of minutes. So again, as I said, you have this opportunity to reframe. So in other words, reframing means changing your view of the barriers, turning them into opportunities for the community to support positive fathering. What we would like you to do in your breakout rooms is to work together to determine at least one opportunity that we can personally pursue to improve father involvement in the community. So for instance, if one of the barriers that came up in your discussions was domestic violence, there are ways to think of opportunities to address that barrier. Community service providers can be trained to conduct high quality domestic violence assessments. You can involve both fathers and mothers in those assessments. You can identify the needed service and referrals. So making sure that you partner with domestic violence agencies in your community, particularly here in Georgia, and I think it's national. We have an organization called Men Stopping Violence. That's a wonderful, organization that you can partner with if that, domestic violence is a barrier that you need to address. But there are some other opportunities, other associations that you can think of. And so this is just an example of what we would like you to do in your groups. Think of a barrier, one of the things that you talked about in the previous session, and then come up with some opportunities. As a group, we want you all to come up with 3 from your list, just 3 barriers, and brainstorm some of the opportunities for each one. We know that there are a lot. You can think of a lot of barriers, but we want to be solution focused in this and really think of ways that we can take action because there are, as I noted, a lot of opportunities where we can make a difference. So if we can go ahead and open up the breakout rooms. I believe, I'm not sure if you all will be sharing the worksheet that helps you all to kind of list out 1, 2, 3, which are the barriers that you want to address, as well as an opportunity or opportunities underneath each one. But we can open up the breakout rooms now. and give you all the chance to talk about these things.
So my apologies, Ms. Washington, if you back. I know we got kicked out. My apologies. I ain't do it. I ain't do it.
Well, we were deep too. We were just getting there.
Yes, I understand. I mean, this is important work, and it does definitely take time to think through and come up with another type of solution. You know, because we do get stuck on the barriers and all the problems, you know, and things like that. And so it takes us a while to actually get to talking about, all right, what are the opportunities? So I get it. We had a very short amount of time. And I'm going to call on Dr. Gross, his group, to share one opportunity that you all came up with.
Yeah, the one that we came up with was actually, I was talking about a colleague of mine who had to go through the legal system. And during that process, in a lot of ways, he became an expert on the law. And so is there an opportunity for dads to partner with a law school because they've learned the intricacies of child custody, child support, and then that kind of breaks through that other barrier of employment, how we notice how a lot of the fathers are claimed to be deadbeat, in actuality they're dead broke. So they're able to capitalize on the fact that I've had to go through all this legal stuff. Now I'm a legal aid, paralegal, lawyer, etc. Now I can pay child support. I can begin to change some of these things. So that was this innovative idea that we came up with in our group.
Wonderful. Now we just got to find that school that you're going to partner with and that contact, and y'all can get rolling. Mr. David, what did your group come up with?
Well, we had three different things. We still went back with the stigma. We started talking about the mental health aspect, but we actually when we got to the birth setting, we actually started talking about doula, because one of my sisters is a doula and I'm a doula as well. And the brother was like, okay, you know, he listened to us talk, and then at the end he was like, well, what is a doula? Oh. And that was like, we both looked at each other on screen. It's like, man, now this is an opportunity. Like I say, so we can share this information so they can understand what their rights are at delivery or at the hospital, but also that we as doulas, we're there at the beginning, working from the beginning of pregnancy, helping them to get connected with mom, and we're going to talk exercises and understand the development of the baby, and so they can be in tune with what's going on. So they're connected from from inception all the way through birth. So that's where we were, and the whole point was like understanding the dad's birth story, his birth story. You know, where was he? What was going on when he was born? And we talked about how mom, like I said, hey, if you don't know it, ask, connect with your mom or connect with someone that was there when you were born to find out where you are, because you only know as much as your father figure or father knew, and they only know as much as their father or father figure knew. So it's like, so we're looking to gather more information on that one, but definitely, like I said, that birth story.
Yeah, good. Sounds like some great educational opportunities across a number of spaces, whether it's with the agencies in terms of improving their attitudes towards fathers when they come in, and also educating fathers, making sure that they know about, like you said, their rights, and know about the role that they play, particularly in that prenatal to postpartum stage. So
yeah, and we mentioned Healthy Start, and there are two located in New Orleans, so that they can definitely reach out and take part in.
Absolutely. Great partners. All right, Mr. Creasy.
So we also did 3 barriers and turned them into 3 opportunities. And our barriers were policy, father participation, and then racism. So we had a few for each one of them, but just in the interest of time, I'll just share one while I talk through them all. Policy, we mentioned having the administrators examine policies and make them equitable for fathers. at the same time, including fathers in these conversations that impact them and hearing father issues directly from them so that they issues can be addressed in the restructuring. Father participation, that's kind of twofold, having dads participate, and then also after the invite, having dads actually come in. So incentive buy-ins that relate to the culture of the dad, the locale, and then also thinking about assets in the community to be ambassadors for recruitment / outreach. And then racism, and we were talking about like if we should just focus on like specific items within racism or just talk about it in general. And we figured it would be in general, but more systematic racism. And the biggest takeaway from that was just having a common analysis of racism within that group. And then understanding, making shifts from there, basically making shifts from there. So yeah, that's what we talked about in our 10 minutes, and it wasn't enough. So I'm looking forward to continuing these conversations. Thank y'all for letting me share.
Yes, absolutely. Great job. Great job for everyone. There are definitely tools, as you were able to talk about. There were tools, there's frameworks, there are other agencies within your community that you can partner with and take these conversations beyond this Zoom room, right? And start to actually get some things in place. So I hope that this was helpful and that you all continue to keep the ideas going, continue the conversations, continue to connect with each other so that you can appropriately serve these fathers and their families. Thank you so much for your time and your attention and your efforts. And I'll turn the floor back over to Mr. Clark to take you further.
Thank you very much, Dr. Latrice Rollins, Assistant Professor at Morehouse School of Medicine, Prevention and Research Center. These conversations are just blooming with so much insightful and humbling perspectives and data. And we did all of this just within the past minutes. So it's powerful to do that. Well, speaking of time, it's 12:06 Central Standard. We're gonna go ahead and stop me if I'm headed in the wrong direction, but I believe we have lunch right now. So we'll take that time. We'll be back in 30 minutes. Yeah, we'll be back in 30 minutes. So y'all enjoy your lunch. And when we come back, we'll get into the Dads Speak panel with moderator Greg David of the Community Engagement Coordinator at Family Tree Information, Education, and Counseling Center. So thank you, Latrice. Once again, appreciate you. I'll see y'all back in a little bit.
I hope that you had a great lunch or snack, whatever you were able to get in these last 20 minutes or so. My name is Shedrin Burnside, and I'm the Executive Director of Compassion Outreach, one of the hosts for today's event. And we've just had the privilege to work with a number of phenomenal organizations. And one of our co-hosts, she's unable to be with us today, but I did want to plug this amazing work here in the city of New Orleans. So Melanie Richardson is one of the co-founders of Training Grounds, and she also serves as the executive director. And Training Grounds is a nonprofit that assists families as well as professionals throughout the greater New Orleans area with creating learning-rich experiences for children and positive child-adult interactions. And so I just wanted to plug her work here, but also wanted to share this quick little video clip. So in just a moment, we are going to get to hear from dads. And we know that it is really important that we include the voices of fathers in the work that we are doing. And so take a look at this clip from Dr. Perry.
When I think about the co-creation model as it relates to community engagement, I think that we do ourselves some favors there by sitting down with men, engaging men in discussion and conversation, authentic conversations with these men about what it is that not only that they need, but how it is that they would like to be served. You have to spend time in community. If and when you can do that, my experience tells me that people are able to separate folks who authentically and genuinely have their best interests at heart versus people who are there to make sure that they get numbers and that they get outputs and that they get outcomes, and that is their priority over and beyond whatever their well-being and the interests of the community are. The opportunities for community engagement in the context of fatherhood, I think, are limitless.
I'd like to introduce Mr. Greg David. He's the Community Engagement Coordinator at the Family Tree Information Education and Counseling Center. So without further ado, Greg David, it's on you.
All right. I appreciate that, Farron.
Thank you.
And I want to welcome everyone to the second half of our great show and to our segment on Dad Speak panel. I'd like for you to sit back and enjoy this ride with us as we take a journey down the path of fatherhood from some very diverse men. Say, I'm Greg David, like as Farron stated. I'm also a father of 2 girls. So with that, like I say, and understanding this dynamic of fatherhood, I think it's best that we sit and we actually hear from these dads. So therefore, without further ado, I would like for you to meet these brave men on our panel. Mr. Jared Baptiste, Mr. Daryl Creasy, and Mr. Sean Holden. So gentlemen, I'd like for you to step up and introduce yourselves to our conference, give your name, family dynamic, or something that you would like to share with us here at the conference.
Good afternoon, everyone. I took a spot like Daryl. Sorry, brother.
No, you good. Age before beauty, man. Age before beauty.
Always. My name is Jared Baptiste. Like Mr. Greg said, introduced me. I am husband and father. I have one daughter who's 4, going on 40. I have been a nurse for 12 years, pediatric and some adult experience. And once again, I'm happy to be here. Thanks for having me.
And I am, I'm sorry, go ahead. And I am, salutations, everybody. How y'all doing? My name is Daryl Creasy. I am the program manager for Fathers Matter. I have a background in community organizing with fatherhood advocacy, background in education, working at Delgado with adult learners, and most recently began to become more versed in anti-racist work with PSAB here in New Orleans. I am a dad of 2 children, a husband of a wife and a dog, it seems. My kids are 16 and 15, and the dynamic is a lot. So I'll wait for the questions to share my dynamic.
That's not a problem, man. Like I say, we definitely appreciate you gentlemen joining us here. So I don't see Sean, but we could still roll. Like I said, we don't have a problem with that. So Daryl, like I said, because I know you, all right? And I know some of your dynamics. So could you give us a little something about the dynamic of you and, like I say, in your fight, in your journey for your kids?
Yeah, most definitely. As we've been talking about barriers, how we started off our conference, I believe I have had my own world of barriers and limitations, just trying to be an involved dad. I say this in jest, but it's kind of true. Since my children have been alive, I have been actively fighting to be involved in their lives. And throughout this process, I have frequently visited the court system, frequently visited child support offices, and frequently spoken to community resources to get some assistance, support, knowledge about how I can maneuver better around these barriers. So yeah, it's still a journey.
Okay,
To this
okay.
day, it's still a journey.
So, well, did you have any of those challenges in navigating the process? Was there like a journal, or was there something in place that you can follow, or how did that transpire?
You know what? There was absolutely nothing in place. I know now, like, I mean, definitely trying to navigate the court system, I had no support whatsoever. I reached out to a lawyer at the very beginning, and the lawyer was pretty much a waste of time and money. So I wound up having to learn a lot of things on my own as I moved forward, and came to a point to where I felt comfortable enough to be able to utilize the knowledge that I learned within the court to a certain extent. And I know now they have, well, in New Orleans at least, there is what they call a self-help desk to assist folks who need some support with understanding what they need to do, what they need to file. But yeah, that wasn't around when I started my court journey.
Okay, and I guess in speaking those same terms, like say, I'm sure, but what was the emotional impact of this this process on you?
Ah, man, it's like extra stressful. I just remember, I kind of reflect back to what Brother Channing had mentioned about having a positive role model in the house, and reflecting back on my own childhood, thinking that my dad was around, but not as around as I would have liked him to be, and trying to not have that be the situation for my own children. Coming against those obstacles and those limitations really put a stress on me personally, so much so that I had to seek out a therapist to kind of help me guide my emotions through all of these situations and experiences. So yeah, it was, and it still is very stressful, but I have mechanisms in place at this point.
Excellent, excellent. Well, that like I said, kudos to you, and many blessings on that as well. Brother Jared, like I say, I see that you're
Yes,
a
sir.
registered nurse.
Yes, sir.
What led you to that field?
If you ask me, I can be honest with you. I think it's just was my calling. I can honestly say that. I remember being 17, and I always wanted to help people. I always felt that was just in me, just a caring person that's in me. But I was sitting down, 17, not knowing much about just life. Obviously, as a 17-year-old, probably even as 38, to be honest with you. But I was sitting down. I remember talking to a nurse. Now, I would be honest, that's where God put me. I can say that was a turning point. I was talking to a nurse, and she was a registered nurse, and she was explaining to me how she went back to school and just gave me some information. And being 17, I say, no matter what, how long it's take, I'm gonna be a nurse, even if it's 27, thinking that 27 is old, right? At 17, I remember saying that. But that's what God put me. If I would talk to a doctor that day, that's what I would have been, a doctor. If I would talk to a hospital administrator, I honestly believe that's who I would have been. I can say that was my moment in life when I knew I wanted to be a registered nurse.
Okay. And I guess I'll follow that up with care. Like I say, you're a father now. Like I say, you've been on this journey for a moment, and being in the healthcare related field, how would you rate the healthcare services that you as a father, or how were you perceived during this process during for healthcare services?
So be honest with you, I actually have background knowledge of how the system works, right? Because I'm on both ends of it. So obviously, being an African American male, and it plays a huge part. Just being a male, but definitely African American, there are not many of us in that field. So you walk in a room, you're taking your child there, or let's say you take your wife or any family member, you're treated differently because they don't know who you are, right? It's not known to have an African American male with education, especially in the medical field. So you definitely, you lose you're vulnerable. You lose that voice. So at least it's that voice is taken from you. I'm not gonna say lose, I'll correct that they take that voice from you, or not necessarily given to you because your father, fathers come there, they gotta call your wife, hey, when the child's date of birth, how you spell a middle name. Like, you'd be surprised being a nurse, how many fathers have to call and say, hold on, let me go call my wife, all the shots up to date. So you're automatically not even given any ounce of thought when you're the father and you walk in the room, especially when you have your another person who's the woman or the female there. They're not asking fathers in anything, because the fathers never know. They don't know where the apostrophe go in the name. They don't know how many R's, how many A's they have in the name. So you lose that voice, honestly, as a father. It's not given to you. I'll be honest with you. It's not given to you.
Okay. Like I said, I definitely can perceive that one. So I have a question, I guess, for both you guys here. Like I said, when you were pregnant, and I'm saying you, like I said, this is in a term of an inclusion, like I say, of your presence now as a father. So in what ways were you encouraged to be a part of those doctor's visits? Were you ever encouraged to be a part of those visits?
I just was because of my background. I'll be honest with you. I had the medical knowledge that I have the medical knowledge that my wife don't have. She had a complicated pregnancy, so I had to step up to the plate just to basically of my knowledge. But as a father, just to pick it back on you, no matter how much nursing experience I have as a father, I still don't have the senses of a mother. I can tell you about kids. I just don't have the senses. So for me, in the pregnancy standpoint, I had to step up more because she had a complicated pregnancy. So I had to be involved more than just going and get Frosties and fries at whatever time of the night. So my situation was different. I was forced to be pushed into that role.
Okay.
I had to be more caregiver than husband, but I was forced.
I was about that's what I was going to ask. Like, say, how did that skill set come to play as a caregiver?
So
like
actually, go ahead.
Like say, as a caregiver, knowing that, like say, about the complications, were you overwhelmed or?
No, I wasn't, because I was natural, but at the same time, us men, we have a tendency to put our foot in our mouth. So I couldn't, I didn't know what hat to take off when. It's like, okay, you're not supposed to say that, even though it's the truth. She's not trying to hear that. So I definitely had that battle of I had to start saying, okay, you want my professional opinion or want my father husband opinion? And sometimes that didn't even matter which opinion was. So you learn to sit back and just listen, cause
well, that's a sign of a good husband. I'm gonna give you that. Like, I'm gonna give you kudos on that one. Daryl, same question. What was it like when you were pregnant?
Really and truly, man, thinking about what Brother Jared said about like the healthcare system kind of having a stereotype that the father is aloof, right? And kind of keeping him out of the process was on my mind. On top of the fact that when I got my children, even before I had my children, I like prayed for my kids, you know what I'm saying? And when they came, I was like, hey, this is my blessing. So I want to be fully involved in my blessing. So I had the mindset to participate off the knowledge that this was meant for me. You know what I'm saying? This was my responsibility. So in a lot of ways, I feel that me getting confirmation that the Lord was blessing me with what I asked him for, gave me the responsibility to say, I am going to participate in all of the visits. I'm gonna know everything. I'm gonna ask questions like that. That made it more relevant for me. You know, that made it more relevant for me.
Okay. Well, in that same, in addendum to that same question, did you guys ever experience any or felt any discrimination at any point during this process?
Definitely,
No, yeah.
definitely.
What was?
Definitely.
What was?
So once again, when I initiated, well, when I started off, I said, you don't have a voice. My wife, my daughter, I wasn't involved in the care. Of course, obviously they don't know I'm a registered nurse until I start speaking the terminology, right? And you'll be surprised, and I just tell everybody, be an advocate. Please be an advocate for yourself. If you don't know, you have the right to ask questions. That was just a little sidebar, but they didn't know. So when I suggested something or I say something, they spoke to me as if I didn't know. One, Michael said it's a race thing, but being in the hospital, it has some underlying tone to that being race. But more was just the father. You know, you don't know. You know, fathers don't, be honest with you, we don't know much. I see it on a daily basis, right? If it's not in that text message or in our little note cards, then we stuck, right? And then they'll say, hey, ask him. So I had one situation, I give it a quick situation. There was something going on with my daughter, and I told the doctor I didn't agree with the care that she was given. Of course, I was completely ignored by it. One thing I was fortunate with is that I knew doctors, and I knew that one of the doctors that was taking care of my daughter. So I was able to get on the phone and make some changes. But if I didn't have that connection, I would have been just another father with no voice. And then if I became agitated, I became that father, that aggressive Black male. And it's just a vicious cycle, honestly. And I'm not trying to make this more about race, but it's just a vicious cycle of being a father. You're not allowed to have a voice in a female dominated environment. I'm gonna be honest with you. You can't have that voice. Because you become the aggressor, they call security. So with those things being said, you just don't have a voice. I'm gonna be honest with you, really don't.
Okay. Errol, same question, sir.
Yeah, my example is pretty much in the same category of them trying to diminish my voice and my role as dad. During my daughter's pregnancy, birth experience, mom, she was kind of going in and out, and I was in the room. I think it was probably toward like the inducing for her to have labor kind of situation, right? And she was in like a whole lot of pain while they doing their dilation checks or whatever. And she was just like, hey, she was hitting the button, right, for the nurse to come, and they wasn't coming. So I just went and was like, hey, she's asking for, an epidural. And it was like, well, all right, cool. But nobody ever came. So I had to go back and be like, hey, 5 minutes ago, I just came. And it was like, well, we heard you, sir. I was like, well, you need to hear hers. Like, come, and it was just almost like 15, 20 minutes before they even came. And then when they did come, they didn't actually have the epidural. They was like, well, we gonna come right back with it. And it's like, dude, I said that 20 minutes ago. So, those kind of experiences, and mine and even others that I've heard, right, about just dads not being able to, they're being dismissed as a voice or authority figure within the room. And it's unfortunate.
Okay. I guess in those regards, we're talking about during the pregnancy and whatnot. Did you receive any educational experience? Like I said, if you went to doctor's appointments with mom, did you guys receive any education that was directed for you as a father in any of those environments?
No, it wasn't.
I don't think so.
It wasn't about me.
Yeah, it was. Yeah,
it wasn't about me. I would be honest with you. It was all about her. Rightfully so, though. I got the textbook dad, any questions?
Mhm.
I got that, but it's all about the mother at the time, which is understandable. I mean, so I don't have an issue with that to an extent.
Well,
But
I kind of do. And I'm gonna say why. Because just how we've been talking on the line, and I want to say Dr. Perry kind of initiated the thought around, dads being involved for every process of the birth, and even from 0 to 3, I'm not sure if it was Miss Austin or Miss Rollins who mentioned that golden moment and then that magic moment, right? Like dads need to be aware, especially if they are in the hospital with mom, giving support. They need to be aware of how prevalent their support is, and then ways to support because of the reasons that could be followed, like, after they give this support. You know what I'm saying? Like how important the support is. So yeah, that's my beef. Like hospitals don't really do that, like not too often. At least in my experience, it did not happen at all. I had to find out information about how to support the birthing experience outside of the hospital, not inside the hospital. And I think that would be a major shift for dads to get their voice back if that was happening within the hospital.
Okay. And I guess I'm going to switch it up a little bit. Let's say, we as men, we're taught that our major role is to be to provide and protect. So we know this. So, but I ask you, do you provide and protect for yourself?
I've learned to. Go ahead, Daryl. Go ahead.
Well, it's okay. It's okay. You could go.
Yeah, you have two people that love to talk, so this is gonna be interesting. I've learned to. Honestly, I've learned to provide and for myself, because I learned that, as cliche as it is, if you can't take care of yourself, you can't take care of your family. So I learned that, and I learned that my daughter was in NICU, and I was trying to be like Daryl said, I was trying to be the best father ever. I was gonna win that ribbon, and I had to be to work for 5:15. I would hurry up and go to NICU at 4 o'clock. And I just remember hitting a point of just doing that during the week. And I'm not gonna say I emotionally broke down, but I just physically was like, I can't do this. Because I was so exhausted of getting at the hospital to 4 in the morning and then getting off of work. And I did that for a while, but I just hit a wall, and I just wasn't any good, because I wasn't necessarily there. I felt like I wasn't there emotionally for my wife. I was there, but you're just being a good husband, right? I'm building up my points for whenever I have to cash them in. But inside, I just was tearing myself down. I just realized that it's okay that you have to step back. And when you want to be that super dad, like Daryl said, you want to be there. You don't want to step back, because you feel like that's that crucial time that you're going to miss something, right? When you step back. So, I just had to learn that it's okay.
Okay. Daryl?
So yeah, I have, how like when you hear like some nails go across the chalkboard, that cringing that you get when you hit, like that's what I feel when I hear people say dad's just supposed to provide and protect. And I'm like, dude, like that's all I'm minimized to, providing and protecting. You know how much I do with my kids? I can run down a laundry list of how much I support my kids emotionally, homework, thought energy, giving them ideas to be better versions of themselves. Like there's a laundry, and then not talking about the emotional support that I have to give, to the stresses that they having in the world, trying to become teenagers and trying to find themselves, on top of the stress that they getting from the other side, when they go over there, and I'm having to balance that with what I do over here. And it's like, man, I'm so much more than just a provider and a protector, yo, like way more than that. I'm the other half. Like, don't put me in no box. So yeah, that's I don't know. I'm sorry. I got on my soapbox for a second.
No. Like I said, you're being real. You're being real, and that's what we want to hear. Like I say, because I know we all have our own set. We all have a story. We all have a story about, like I said, about us. So with that in mind, do you know your story, which is like his story, meaning that where did you get your knowledge at? Where did you get your comfort level, your understanding for being a father?
You know,
Where did that come from?
I'm a back up just a little bit and say, well, no, that's not even really a backup. Just how Brother Baptiste was talking about, he was burnt out and he had to like step back. There's many times where everyone, especially dads in particular, because we already got the stigma, the stereotype, the expectations, so we getting all that pressure on top of what that external pressure outside of whatever we got going on internally. You know what I'm saying? And I'll be quite candid. For me personally, when we started these dad discussions with Fathers Matter, that was a very helpful and supportive outlet for me to be able to communicate with other men, other dads, other Black men in particular as well, to understand that I'm not going through this by myself. You know what I'm saying? And through dad discussions, I mean, it's been highly therapeutic, even so much so to us talking about therapy within the discussions and then having folks come back to the discussion saying, hey, I talked to my therapist, I'm considering therapy, et cetera, et cetera. So yeah, it's definitely a journey for you to be able to know your limits, but then also give yourself some grace to refresh and reset.
Yeah, excellent point. And Mr. Baptiste, there was a question asked, were there any mental health professionals available for you during your time of that struggle?
There probably were some, honestly, that there was there, but I don't feel like I was in a situation to even, and I felt like I didn't have time to reach out, but I can be honest with you, within the last probably 5 years, the thought of therapy or reaching out to someone that's starting to no longer be taboo. Even though I've been in health field, I never felt like it was taboo, but just the benefits of having a therapist, even if you're having a good, you have a pretty good life. But I didn't reach out for it more because I didn't feel like I was at that point. Honestly, just I have enough self-awareness. I'm not gonna say enough. I have self-awareness to know, and it's just being my profession, when it's time to step back and reevaluate. So there probably was a they're out there. Let me say that they're out there. I just didn't feel like I was at the point where I needed to reach out towards. Like I knew what the situation was and I knew what I needed to do. So as hard as it was, I had to step back. So
okay. And that brings me to my next line in questioning. Have you guys ever heard of the term ACEs? ACE with the apostrophe S.
I don't think so.
Yeah, I heard of it. Like adverse childhood experiences or something like that.
Yes, sir. And those things, like say those ACEs, just to give an example of a few, like child neglect. This is anything that happens between the birth 0 to 17, before you become an adult. So if you've experienced any type of child neglect, emotional, sexual abuse, physical abuse, intimate partner violence that you've seen, heard, parental separation and or divorce, that's just to name a few. And we know that in the African-American community and within our families, we're not supposed to talk about those things outside of the family. So if you look into to see what your ACEs were, in your upbringing now as a father, do you feel that if you would have known that earlier on, and this is directed to you, Mr. Baptiste, earlier on, if you'd have known this as a youngster, that you could have sought out help or just or an opportunity to vent or have an avenue to go to? to discuss those things? Or was it, like you say, taboo, forbidden, where you couldn't do it, even if you wanted to?
No, I'll be honest, I don't think so, just because I mean, I've already addressed that. I don't have no problem saying I'm a sensitive male. So if I grew up, I can't say I'm blessed that I grew up in the household that opinion was welcomed. I didn't grow up to in a household that say, do as I say. I mean, after probably the second time you talking, you got to do what they say. But my opinion, I grew up in a household and opinion was welcomed. And I grew up in a household where it was okay if you wanted to cry. As tough as my brother, I think my brother's probably one of the toughest people in the world, and my dad's probably one of the toughest people in the world. But I grew up in a household where if you had emotions, no matter how, if you had the mad cry or the sad cry, it was welcome. So
That's good deal.
in the individuals I know who didn't have that environment, yes, I think if they know early that it's okay to cry and express emotion, it would be beneficial to them. Because I experienced that now with teenage males. I said, man, it's okay. Look, if you want to cry, man, let it cry. It hurt, cry, let it out, But I was fortunate that I grew up in a household where emotion was okay to express. So
okay. What about you, Mr. Creasy?
I mean, I definitely agree. I feel like the more knowledgeable you are of your experiences, your own self-awareness, the more that you can utilize supports that are available to you. When it comes to, and you, by you bringing up ACEs, and being that time frame is really when you're a teenager, right? And then considering, my childhood, my teenagehood, and then the usual African-American household, right? There is a lot that happens in that childhood, preteen, kid, or young adult like time frame. And it's very clear that what happens as a young child gets programmed, so to speak, into your personality, right? So like I said, the more knowledgeable that we can be, let me back up, the more nurturing that we can be in the family household, and the more knowledgeable that we can grow into, the more knowledgeable that we can be as we grow into adults about these situations, I think will make a tremendous shift to our families and our communities.
agree.
Okay.
That's
And
excellent. That's an excellent point.
yeah, and that leads into our next one. Do you believe any of your childhood experiences has had an influence on who you are today? And to explain.
Is that a real question?
Yes. Oh man. Yes, indeed. Go ahead, Daryl. I definitely.
No, you got this one. You got this one.
Yes.
I just was responding. Look, sound like you was thinking.
Definitely. I grew up with a dad. He started working when he was 12, knocking off a can off the can good with a stick on right there on Louisiana across from Holy Ghost. So I grew up with that, but then I grew up also with the nurturing, like Daryl said. So it definitely shaped me now. I don't have a problem passing my opinion. I don't have a problem with hard work, but I also had to break some chains because my dad was because my dad was so old school. So it definitely shaped me. And every now and then Jerry comes out in me because I am my father's child. I feel sorry for my wife. But every now and then Jerry comes out in me and I have to step back and be like, whoa. So it definitely shaped me. Have to break chains for positive and for negative, to be honest with you.
Okay.
Yeah, I totally agree. The same situation for me. My childhood, if I would have went down the path of my teenage self, I would not be in this room right now. Just to put it simply, there have been a lot of aha moments, a lot of self-assessment as a young man that I knew I had to have within myself to shift my thought process and then also shift the direction and the trajectory of my life. And like I said, you know, in my previous statement, like the nurturing of a child in that home really does make a big difference. So yeah, I stand on that.
Yeah, and I definitely appreciate you sharing that that fathers can be and are nurturing. Like I say, and that's one of the and like Jared stated too about, you know, his father being old school, but sharing that information, you know, like say the new way of doing things. So with that being said, in the community, were you ever engaged as a title as a father in the community? This could be from Miss Jane down the street, Mr. Johnny up the street, or as a teenager or as a youngster. Were you ever engaged in those type resources, and are they still available, and you know how to access them now?
I didn't. Are you asking me as a father, or are you asking me as a child?
Well, as a child before, and now, like say, well, your younger version of you as a father. First, mom's pregnant. Well, we're pregnant, and we're here. What did the community say to you, or what did you receive from the community?
I didn't have anything, to be honest with you. Besides Nord Camp, that was about it. Besides going to Catholic school, that was it. I don't think I had anything remotely close to fatherhood until I got to St. Aug, to be honest with you. That wasn't provided nowhere near like it is now. So
where would you have gotten that knowledge base from, or where did you receive most of this information, or just a talk about being a father?
Just seeing what you grew up with. You know, okay. that go back to psychology. Everybody, you know, how many of us can honestly say, I'm not gonna never be like my parents? Yeah. You know, I'm not gonna never be like my mother or act like my parents, and then you just wind up saying, oh Lord, guess what? You know, so it's what you grow up with, honestly. For us, you know, and just in the times, to be honest with you, just even in the 80s, I can look back and say, man, the resources they have now, I definitely didn't have back then. We just didn't have the resources in the 80s. And that goes across the board, I think, for just everyone in general, you know?
Okay.
Besides church, that was it for a lot of people. Church was where they got that from.
Okay. Daryl, anything you want to share with that?
Yeah, I mean, from being a new dad to a veteran dad, there definitely are more resources now, right? Since we, you know, have, I guess I can call it somewhat of a spotlight on dads and lifting up fathers as integral parts of the household and the family. But when I was a new dad, I don't believe there were any specific resources that were offered to me or suggested to me to help me through my fatherhood process.
Okay. Well, one of my last questions, if you had the magic wand today, see, there it is. Like I said, you have the magic wand today to make change in the fatherhood community, in the African-American community in dealing with fathers. What was that one thing you would do?
For me, just be present. Just start with being present. I mean, if that one thing I had to change, be present.
Excellent. Mr. Darrell?
If real life, hey, man, be quiet. If I could, like a real magic wand, or like a for real magic wand, that's what I do. I'll take away child support, and then I'll also stop that arrears deal. Get the system out of Black people houses. You know what I'm saying? I turn mass incarceration of Black folks into not a real thing, and then I also lift up resources and supports for new dads, right? Or soon to be dads, so they can have all that they need to assist with the birthing process.
Excellent.
That's what I do.
So And wrapping up, man, do you guys have any parting questions or statement you'd like to share with the rest of us here at the conference?
No, my little soapbox moment is for the brothers and sisters that's on here. The male role is more important than we ever realized. I don't think that we actually understand that. I tell you, if you've been around me, I'll say this 1,001,001 times and then some. The father's role is invaluable to the life of their future generations. Family, I always say, if you think about the first person a young girl receives love from is her father, right? The first person that a boy who can actually be taught how to be a man is the father. And I think that we don't realize that no matter how strong our single parents, mothers are, and our sisters are. And my mom was a single parent, even though I grew up in a co-dominant, cohabitat family. You can't teach a boy how to be a man. You just can't. And so for men, our role is more valuable, priceless than that we imagine. So that's something that we should wear on our chest and help us keep our head high and just fight for your children or fight for your family. So that's my soapbox.
Mr. Darrell?
So yeah, my parting words will be to the practitioners and the policymakers on the line. Let us continue this conversation with action steps and making progress toward making these shifts so that way dads can be involved. And to dads, moms, families, just be present, like Mr. Baptiste said, but then also, give dad a break, stop putting all these extra expectations on dad and just let him be dad sometime. It's just unnecessary friction and unnecessary drama is a big gap in effective parenting. So yeah, I think let's give these people some parenting classes. Man, where Melanie at?
Well, I definitely want to commend you guys for being so open and so and so thought-provoking, having these thought-provoking comments, like I say, to the panel. And I want you guys to know that, hey, whatever you do in this journey, like I say, in this life journey as being a father and working in the community, you guys are diamonds out there. You guys are the light. So I want to commend you on being a part of this panel. And we look forward to many more talks such as this.
Yes,
So,
yes.
So I want you guys to hold it there and keep it together and keep encouraging these younger brothers as best as you possibly can. So just to let you know, like I said, my name is Greg David. I'm with the Family Tree. I'm a community engagement coordinator. I'm a fatherhood coordinator. I am a doula. I am a 24/7 dad. The list can go on and on and on, but we all have the same episode. We all have the same niche as being nurturing parents. That's all we want. We want people to know that we are nurturing. We're not that angry black male that's out there that's being perceived. So thank you again. And I'll turn it back over to our moderator. To Mr. Clark. Thank you.
All right, thank you. Thank you, Mr. David, for moderating such an engaging, important session on Dad Speak. To hear from Mr. Jared Baptiste, Darrell Creasy, and Sean Holden, who couldn't be here, but the topics that emerged from this conversation is so important. So thank you all so much for your intrigue. Something that you all said made me think of the Far Side, the song Running, the three different situations in that hip hop classic, nobody never taught me how to knock somebody out, so thank you so much for your examples, because these young men, and every father's a son, we are faced with so many things. So thank you so much for that panel. Now, we'll go ahead and branch into the next part where Frankie is going to share with us some information concerning success from the field. It's a video clip with James Murray. So everybody go ahead and enjoy this as we transition into our third and final session.
Good afternoon. My name is Frankie Robertson, and I am the founder and president of the NOLA Group. It's a social justice consulting firm focused on addressing, yes, the social and political determinants of health that impact the overall health. Hey, come on back here. Come on, let's see everyone. Let's see everyone. The overall health of Black and Brown birthing people. And I must say, since this is a fatherhood conference, my husband is sitting across the across the way on the couch, and the deer in the head look like, what am I supposed to do with that tantrum? And he's trying to help, but she just wants to come to me right now. So he's trying to bribe her with everything under the sun, y'all. He's trying, but she's had all morning with him while I was at a conference. So she's like, no, I'm sticking with you right now.
Thank you so much for being here. She's cute.
Oh, thank you. And Dad's waving. But this is my precious Zoe, and my son's waving too. But just to tell you a little bit about my work, I am really happy. I'm really happy. Sorry, y'all. I'm really happy to. Zoe, you're doing that on purpose, okay? You're doing it on purpose. I'm happy to engage today, and I appreciate all the work that you do and the opportunities that I have to engage with Fathers Matter. I look forward to continued engagement because this work is so important. So I will now turn it over to you all for us to take a look at the video clip. And I'm looking forward to sharing that with you too. So from both of us, thank you.
I see federal, state, local, and tribal programs working together being important to fathers because really we touch families on all of those levels, and there may be things in place that impede one level or the other, and we're not able to work around those if we don't communicate, structure time to sit down and discuss, and then begin to identify resources to serve fathers better.
So yes, working together to serve is so important. And thank you, Frankie, for that information. If if you had anything else, I didn't want to cut you off before moving into the next part.
Now that it's just me, I just want to say thank you all for this. I'm going to sneak and talk before she hears me. Thank you all for this really great convening. And I am continuously committed to working with the fatherhood programs because I think it's very essential. I'm also a doula, and I totally believe in engaging fathers in the process and making sure that their voices are centered. So thank you, everybody, for everything that you are doing. It's a pleasure to be here.
Thank you so much, Ms. Robinson. All right, so we'll go ahead and transition to our third and final session with our facilitator. Our third and final session is creating system level change. Our presenter is Mr. Oliver Thomas, New Orleans City Council member of District E. And then following that, the facilitator will be Ms. Liz Shelthis, Manager and Operations at Crescent City WIC Services. Thank you very much. Mr. Thomas.
Rewind. Thank you, Mr. David, and thank you everyone with this discussion and the different panels. And it's been great to sit in and listen. And it's interesting how this morning we had our roundtable discussion on the Good Morning Show that I host every morning, talking to young men. We've been doing a series of conversations with men, and especially young Black men, about their place or where they feel in our society. I know this focuses on dads, but when you talk about Black fathers and Black men, I think there also has to be a larger discussion. I want to share some information before I get into what we can do in terms of legislatively and how do we have more positive awareness. The Brookings Institute just did a study on Black men and males. And the title in the article that highlights the study says the challenges facing Black men and the case for action. To be male, poor, and either African American or Native American is to confront on a daily basis a deeply held racism that exists in every social institution, writes Brookings Institute colleague Camille Bussett. To meet this appalling crisis, she calls for nothing less than a new deal for Black men. Creating this new deal is one of the core priorities of the Race, Prosperity, and Inclusion Initiative directed by the Brookings Institute. But it also, as part of the new Boys and Men Project launched out of the Center on Children and Families. The elements of this new deal will likely consist of intentional policy making in the fields of education, training, the labor market, family policy. So when you see programs for parenting for women and centers for women and kids, this new study also shows that family policy, special resources and programs for men are also important, criminal justice reform, and tackling concentrated poverty. In the last, Black men are not trending today. As an elected official, as someone who hosts a show, as someone who's watched movies. Now, it's not saying that other groups don't deserve their due, but if you look at resources and if you look at the life expectancy and all of the issues facing Black men, especially in urban corridors, it's not popular to advocate for Black men. Old housing policies show that. If you look at employment statistics in urban corridors, in New Orleans, we celebrate the fact now that the unemployment rate for Black men who don't have any issues, who are part of the working, potentially at the working age, that the unemployment rate went down from 54% to 46%. And these are Black men who pass the drug test, have expertise in certain areas, and have worked in this discipline that they're applying for before. So we're celebrating from 54 to 48 or 46%. When you look at how family court works, in many cases, whether the Black man is wrong or right, even if they're right, he has to prove that he's right. I know several, and it doesn't mean that deadbeat dads and men who are not living up to their responsibility as a father shouldn't be dealt with. But just like the criminal justice system, you're guilty, right? And usually the burden is on you to produce that you haven't done what you've been accused of, or that you're responsible for that. We have a young man, I won't say his name, that we work with here, that his ex brought him to court 6 times. And each time the court system dragged him to court because she said he wasn't paying. And then each time he had to come up with receipts to show that he was. Each time. But they took her word over his, not some of the time, all of the time. Criminal justice reform. Most prison systems or prison industrial complexes, even though they're reforming many of the laws, they don't have any programs around family unification. Even those who allow conjugal visits, I mean, that's just about the physicality part of sexual relief. That has nothing to do with healing the family. And then for ex-offenders, especially men who are returning citizens, access to essential goods, access to transportation, and in many cases, access to quality living is not available for many who return home. So, you know, I think we need to begin with the foundation, not only for fathers, but for the lives and for the consequences. And how do we begin to change policies that actually affect Black men totally? So I'll open with that. And one last piece, one of the ways I think we can improve on the positive awareness around fatherhood, especially for Black men, is to change the stereotype. Black men fall into a category where all, them, they. It is very difficult to get away from what one Black deadbeat dad does, or what one bad Black man does. We hear the stereotypes from our legislators, we hear stereotypes from conservative America, and we hear those stereotypes when our women caucus about what they did, what they do. And in many cases, our children are adopting that. So thank you.
All right, thank you, Mr. Oliver Thomas. In this session 3, creating system level change. Up next, we have our facilitator, Ms. Liz. Is Liz here?
Yes, I am. How are you doing today?
Doing fine. How are you?
I'm doing well. Thank you so much. So first off, I'd like to say that I'm very honored to be a part of this conference today and really just seeing all the wonderful work that everybody is doing to get fathers involved. So just to kind of give you a little bit of my background, I have been involved in the community and doing a lot of community service and different things since I was a young child, first through the church, and then having gone to a all-girls Catholic school in the New Orleans area, you do know that community service is something that's required. After graduating from high school, I went to Northwestern State University of Louisiana, where I had the distinct honor and pleasure of becoming a member of Alpha Kappa Alpha Sorority Incorporated, in which that kind of skyrocketed my community service and really taught me how to build those connections. I saw that not only having connections on my campus, but having connections in the community of Natchitoches, Louisiana was very important in being able to help create and serve the community that we're trying to reach. And so I think that's something that we are now doing with our organization that I work for now, which is Crescent City Family Services. And we are known as the resource hub. We definitely do a lot of community work. And I've had the honor to work under Miss Mary Schulteis, who a lot of you know is my mom. And she's the best at this. She's the best at creating those connections and bringing people to the table in order to help service our community in a better way. And so that's what we're going to be talking about today, is how can we create a system to help propel our fathers forward and to provide them with the resources that they really, really need. So we can go ahead and go to the first slide. Alrighty, so let's discuss, based on this scale, how involved is your organization with fathers and families? So if people can kind of write some things in the chat box, I'd like to see, how do you feel as though your organization is able to assist fathers? Would you say that you're not sure, moderately involved, heavily involved? And I'll just give some time. So we have Mr. Greg, he's saying that they're heavily involved. Daryl also heavily involved. So that's great that we do see that in our community. However, there are large gaps, as we've talked about during this conference, in which dads are not receiving direct care. We have so many things that we are able to offer to mom during pregnancy, but not so much for dad. So that's kind of where we need to start to fill in that gap. So it's good that we do have community leaders in our network that do have these heavily involved programs, but we need to see how can we get that and bridge that to other organizations that may be in that not sure or moderately involved area. So we can go ahead and go to the next slide. Alrighty, so now I want you to describe your personal level of involvement. So if we can have some personal stories, I know how involved both Greg and David are involved, but are you involved in an individual level, a program level, a community level? This is really an opportunity for us to have an open conversation so that we can see where we need to strengthen. So we'll wait for some answers. So we have program and community from Mr. Bob. And then if you can give us a little bit more information about how you're involved in that program and in that community level. Alrighty, so we have community. Now, Mr. Thomas, would you be able to kind of elaborate on that for us and talk about how you're involved in that community level?
Yeah, mostly through working with organizations that do outreach, whether it's mentoring, linking men back with their own kids, or as surrogate fathers in the community, doing a lot of outreach. And if I can say this as a legislator, I have consistently put Black fathers into the conversation, and it can be rather uncomfortable sometimes because, you know, we're not trending right now. And our sisters, thank God, are, and many of our Black women are doing so well today. And usually when we come together around social issues, around programs, and around funding, everyone will sit around the table and talk about, you know, the order of the day, you know, who's on the menu today, and Black men usually won't be. And what I'll say is, hey, wow, you know, what about the report that came out decades ago that said that young Black men would be dead in jail or on drugs by the year 2000? What about the report that came out decades ago that talks about the adverse effect of the domestic court system and how it has on Black men, even though they were innocent of many of the charges? And then, of course, recently, you know, the Brookings Institute in their report, which is in real time right now. So I try to make sure that we are, and if I can add this, like, because I think we need to have, I'm at a point in my life where we can have real conversations. Most of the meetings that we're in, even if it's about Black men, are usually Black women running those programs, or white women, or whites doing outreach, getting millions of dollars for us. And often in many cases, the director, the CEO is not Black male, the assistant is not Black male, the assistant to the assistant is not Black male, and they may have an outreach position somewhere for Black male, similar to what corporations used to do when they gave us the governmental relations thing when we started becoming Black elected officials. So usually I try to make sure we're part of the discussion.
All right, now, Mr. Thomas, I do want to ask you, in your opinion, for somebody who says that they're involved at an individual level, what steps can they take to make an impact, even at an individual level? Because you are at a community level,
Absolutely.
What can they do as an individual to help push this agenda for Black fathers?
Ms. Schultz, it's a great question. It's what I usually challenge people around. Too many people are looking for programs and systems to make a difference. One of the greatest impacts we can have right now, it's good if you're part of a program or initiative or an effort, is to really take it upon yourself. First, within your own family. You know, if we're the best parent and the best dad we can be, we can check most of the boxes for that kid. Now, if you've done that, or if you're not even the father, but want to be involved in a kid's life, find one in your neighborhood, at the school in your community, or the playground. But don't think just because you're not of a program or a program isn't available that you cannot make a difference. Now the other thing is as a voter, as a citizen, continue to support programs that support dads, or encourage your elected officials to support programs that support dads. Housing laws are notorious for excluding men. I mean, as a matter of fact, affordable housing is incentivized if the Black man is not with his family or not with his children. And many of those laws and policies still exist. So if you're not involved with the kid or your kid, be an advocate around public policy.
Perfect, thank you. I think that kind of gives everyone here an idea how, if we are involved on an individual level, or if we don't feel as though our program is really pushing towards father, I think that information that you just gave us is really valuable. And that's one way that we can get that ball rolling. Alrighty, we can go to the next slide. Alrighty, so system level change, this is kind of what we were talking about just now. So we talked about the direct services. So we have that individual, also service of coordination, which is at organization level, and then community and systems. What I can say for Crescent City Family Services on the organizational level, we actually have a program called 504 Dads. We have worked exclusively with Compassionate Outreach with our 504 Dads program, and we now have a fatherhood coordinator who is a Black male that is from New Orleans and that is immersed in the culture. And so we are seeing that dads are wanting to come out. They're interested because they have someone that looks like them, that talks like them, and that they feel comfortable with at that level. So some of the services that we're providing on an organizational level, and then we can have some people in the chat box if you can let us know what you're doing with your organization for dads. We're providing direct case management services. So we're allowing these dads and telling these dads that we're here to support you in the same way that we support mom. So whether that's with emotional wellness, if that's in looking for a job, if it's doing continued education, if it's substance abuse, if it's, you know, something that's related to the child, but also something that we're pushing very heavily is receiving medical care. A lot of our African-American men and men in general do not receive the adequate medical care that they need to in a timely manner. We know that African-American men are predispositioned for a lot of different diseases and cancers, and that all of these things are preventable. That's kind of my soapbox moment, is definitely making sure that we are getting access to healthcare to our Black men so that they can lead productive and healthy lives. And I think that that's something that's really big as well. So that's just kind of some of the things that we're doing at Crescent City. We're also promoting that co-parenting relationship. We do understand that a lot of our families, unfortunately, are not together, and it may not be the traditional two-parent household. But what we're really focused on is co-parenting and what is best for the child. How can you all work as partners in parenting to help propel this child forward? And dads play a very big role. As previously stated in this presentation, there are statistics that show that there are better outcomes with the child if dad is involved, if dad is reading to the child. Even some of our benchmarks at Healthy Start are centered around fathers, because fathers play such an important role in our children's lives. So if anybody in the chat box would like to put some information about what your organization is doing right now to promote system change on an organizational level, I'd love to hear that. Alrighty, so Kylie Mayfield at NBEC, we include programming aimed for fathers. So that's amazing. Now, Kylie, could you elaborate on what type of programming you aim towards fathers? Is it more towards like job readiness? Is it emotional wellness? What type of programming are you doing?
As far as programming, I'm referring to like events. So, like as we are planning out events, we're looking how we can include fathers. So at the National Birth Equity Collaborative, our primary focus is on maternal outcomes and infant outcomes, but we recognize the importance of fathers in that conversation and that work in the community as a whole. So we really wanted to begin adding information and activities for fathers to be included. Like we've done things with Fathers Matters, NOLA, and then as we plan for Black Maternal Health Week, we actually have programming that will be specific to fathers as well.
Awesome. Thank you so much for coming off mute and talking with us today. That was amazing, and we can't wait to see the work that your organization does. Mr. Greg did say, yes, I'm in the process of creating a step families program so our fathers can be present and maintain connection with their children. So again, that's us talking about that co-parenting. I know recently I read an article where they're trying to get away from that verbiage and they're trying to use partners in parenting rather than that. So definitely good information there. Let's see what else we have. Okay, great. So we do have some information that was shared by Dr. Perry, and we'll make sure that we open that up. So from Gerard Hall, very similar to everything. Let's see, sorry, this computer is, okay. Goodness. So sorry, I'm trying to get to your comment to read your latest comment that you put in the chat, but I'm having a little bit of technical difficulty. Okay, so similar to everything you mentioned, Liz, I'm the fatherhood coordinator at SCC Healthy Start. We do events, parenting skills, and then workforce coordination. So those are all things that are very important. I think a lot of times with moms, it's very easy because they're very forthright about the things that they need access to and the things that they need, but sometimes it is a little bit harder because we aren't able to, because so much of our work is done with the mom, it is a little bit harder to access dad. And then when we finally do access dad, as Mr. Thomas stated, we are a predominantly woman run organization. So we don't really know how to bridge that gap or how to know what it is that males need help with when it comes to parenting, when it comes to fatherhood. So that's something that's very important too. All right, we can go ahead and go to the next slide. Alrighty, so there are no silver bullets. Complex needs of families extend beyond what an individual program can support, and community level issues can negatively affect families. System level change takes a long time to achieve, but progress can and must be demonstrated in the interim. Developing measures or indicators of progress can allow a community to assess whether it is on the right track towards goals. So I do know that a lot of us are grant funded programs, or we receive funds from the federal government, and we have these benchmarks or these certain goals that we're asked to meet, whether it's yearly, quarterly, but those are kind of the driving forces to let us know what is it that we need to be doing. So I think that that's very important to keep in mind when we're trying to create this system or trying to create these changes within our community, is that we have a checks and balance system so that we can continue to track our progress and see our forward motion, because that provides us with positive reinforcement when we are getting good feedback and we are seeing the changes, no matter how big or small they may be. Alrighty, next slide. Alrighty, so what organizations need to be around the campfire for fathers? So this slide actually has a whole bunch of different types of partners, but what I'd like to do, I believe on the next slide, this same diagram is blank. So before we look at the other one, I kind of wish they would have been switched around, because I'd like to see who do you think need to be in this system, in this collaborative to help propel our fathers? So first off, we have therapists. I think that's great. Having emotional wellness and mental health professionals for fathers are great. Educators, okay. What else do we have? Child support advisors, mentors. Okay. Healthcare providers are great. Attorneys, fitness coaches, lawmakers, financial literacy. Wow, all of these things are amazing. Yep, so we have financial, yes, financial advisors. I think that's something that's very, very big because as Daryl stated, it's like that nails on a chalkboard, but men are told to be providers and protectors. And so I think that having a financial literacy course can definitely be something. Medical and healthcare providers. All righty. I'm going to put one out there. Legislators, yes. I'm going to put one out there with job readiness and having those like education and trade schools to be able to provide our dads with job opportunities, housing, social services. All of these are great. Always authentic. Yep. Awesome. Let's see. One more message. Alrighty, workforce development. Yes, I think that's great. Trades and colleges and universities to be a part of this as well. Doulas, yes. So I actually, fun fact, I just got accepted into becoming into a doula training. So hopefully by the end of March, I will be a certified doula, and I will be coming to delivery rooms near you to help advocate. Fun kind of story that talks about dads and fathers, while I still have some people putting this in the chat, is that I was actually able to be a part of my sister's birth, which was on February 6th. So I have a beautiful niece now, and her fiance was in the room. And I was there, our mother was there, and then her twin was there. Her twin is a doula. And so we were all in this room together, and they told us, well, Dad, if you want to go stand over here, and if you just want to go stand over there, if you want to stand back there, then you're fine there. And it was so interesting for me to see how that interaction with the father went, I guess, in that setting, because I thought that, of course, the mom and the baby are kind of the stars of the show, but it was very odd to me that they just kind of wanted Dad to play a back seat in that delivery room, when this is such an important part of his life and his experience about becoming a father. And so I thought that was interesting. And so I definitely, one of my things in my work as a doula is that I want to make sure that I am able to advocate for dads and really show dads, make sure the dads are involved in that birthing process. So alrighty, let's see what we have in our chat box. Alrighty, so it says, with this image, it may be assumed, but I always grateful fathers. Let's see where we're at. All right, I'm trying to see, everyone is saying, yes, Latrice. I'm looking for Latrice's comment. This chat box is so tiny. Let's see. All right, so we talked about financial literacy. We talked about that.
I was going to say, do you want me to just say it?
Yeah, that would be great. I'm so sorry. This chat box is really tripping me up today, but yes. If you could please share what you were talking about that everybody was praising in our chat box. Yes.
Oh, yeah, no problem at all. This is a common image that I've seen on other articles and work around systems change and involving fathers. And I always say it's great that, all the arrows are pointing and we're focusing on fathers, but we also need to recognize that fathers need to be at that table as experts and, those that know and have that lived experience and know what needs to be done. So that was just my comment.
Sorry, I was on mute. So sorry. I was reading the chat box that talked about domestic violence support. And that is definitely something. And okay, and then Mr. Greg said that they provide the DV support in the matter.
About how you do chat.
Alrighty, perfect. And then do we have any more slides after this one? I believe this may be the last one. So creating change at a system level, who are the key players in your community fatherhood networks? I think that everybody that's been called and has attended this conference today, we are all key players in making sure that we're promoting the system change. Every single person here, I think, is dedicated to creating a space for fathers and really making sure that fathers are involved in every step of pregnancy. So who do we already have as strong partnerships? Again, in this meeting, I think it's important that each of us make sure that we connect with one another to see to be able to create a space for us to all come together and see what we're doing as organizations. So Crescent City Family Services actually has a community action network in which we meet on a quarterly basis. And we come together and we talk about how we as organization can come together and reach common goals. And how can we collaborate on events? How can we come together and bring together diverse populations that we each serve? We also have a subcommittee for our fatherhood, which our next meeting, if everybody wants to write this down, it's going to be virtually and it will be on March the 29th. And we'll just be basically having a meeting introducing our new fatherhood coordinator, Mr. Stevenson, to the various members of our Community Action Network. But we'd love if you all could come in and talk about what your experience has been working with fathers and really help to shape our fatherhood program as well. Where is the opportunity for strengthening partners? So I don't think, okay, so how can you register for the meeting? So if you all would like to go to our website, it is crescentcityfamilyservices.info. So I'm sorry, ccfamilyservices.info. I'll put it in the chat box. But if you are registered for our newsletter, you will automatically receive an invitation to the 504 Dads subcommittee. So we'll make sure that I put that in the chat box as well. So Mr. Thomas, are you still on the call?
Yes.
Okay, I would actually love to hear from you and what your opinion and really get you to answer this final question on how might we build or strengthen a coalition to support fathers? So in your opinion, how can we do that?
I was actually thinking what we're doing right now, and
Okay.
having conversations amongst men and women who see the need to strengthen Black fathers, to invest in Black fathers, continue the work that Darryl Creasy, Mr. David, and many others on this call are doing, but also to highlight it. You know, if it's something to do with entertainment, something to do with sports, something to do with something bad, Black men are featured. Even the little programs that feature the little you know, bad Black kid or at risk, or what we call here opportunity youth, who we haven't given opportunity for, there's public awareness around it. But when you talk about Black fathers, other than the system that penalizes them for what they say they should or shouldn't be, there's very little awareness. So I would hope that organizations and efforts like this continue. Maybe just think, right? You're in 2022. Do we really need the Brookings Institute over the last couple of years to do a study to tell us that Black men, which includes Black fathers, are in trouble, right? Do we really need this rash of indiscriminate violence that's happening all across urban America to tell us that Black fathers and Black men and Black boys are in trouble? So I would think just to begin to reimagine who we are, our contributions here. I think there needs to be a concentrated effort to get rid of the stereotype that is attached to us, and continue to grow and have as many advocates as possible. But the work you're doing, the work you do, Liz, is extremely important, and the work that our women do, who understand our value and fight to keep us at the table, is equally as important.
Thank you so much for that. Very well put. Next slide. Are there any more slides after this one? Alrighty, so let's make sure that we stay connected after this. Like I said, I'm going to go ahead and put in the chat box Crescent City Family Services information. As of right now, we actually have a community action network of over 75 community partners that service or that provide various different services, and pretty much everyone that is on this call right now, we have as a part of our community action network. I see a lot of familiar faces, and I'm very excited to see that, but I also see some new faces and names that I'm not familiar with, and I would love to be able to connect with you all to see how we can help to strengthen our community and also our networking, so that we can be able to provide all of our clients with the resources that they need. So I went ahead and put that information in the chat box. I am going to also go ahead and put my direct email information, so that if anybody would like to collaborate with us on any events, or would like to reach out to our fatherhood coordinator, I'm going to go ahead and put his information in there as well. His name is Robert Stevenson, and unfortunately he had to go out of town today for a family emergency, so I'm here by myself, but that's okay. But we're very excited to continue this work. We're very honored to have been asked to be a part of this as well. And we definitely look forward to collaborating in the future. Mr. Thomas, if you could please leave us with some closing words on how we as a community can do better for our fathers, and especially our Black fathers. I'd love to hear a little bit from you.
There's a saying that was written in 637 BC that applies to how people can make a difference. And Liz, I thought that was really profound when you asked the question about what can folk do individually, right? And so I think this was written by Lao Tzu, Confucius. It was someone in some of the early readings in history that I studied. But it says, if there's righteousness in your heart, there'll be beauty in your character. If there's beauty in your character, there'll be harmony in your home. If there's harmony in your home, there'll be order in your nation. If there's order in your nation, there'll be peace in your world. You can start inside one Black father's heart and change an entire world.
I don't think it gets any better than that, folks. Thank you so much. That was really, really beautiful and wonderful closing remarks to go out on. So we'll turn it back over to Compassion Outreach.
Thank you so much, Liz, for that. And at 2:08, we still have some time as we wrap up this wonderful conference. We can close by giving a bit of a summary of what we got out of the conference. And if I'm taking the wrong steps as we're wrapping up, I appreciate your patience. Let me know. Maybe we could take some time to just reflect on creating system level change, session 3, or any of the previous sessions, what was covered. Once again, Oliver and Liz, thank you so much for that insightful presentation. So if you want to tap in, maybe we can answer, what is one small thing that you can do from where you are to address the current challenge with resources and authority that you have right now? So from where you are, if you can go ahead and unmute and just share what you do and what you like to, what impact that you can make from where you are.
Well, I'm gonna just say this. Man, Councilmember Thomas' closing statement was like profound.
Yes, it was.
I gotta say, it touched me. It touched me. It's real important to realize, like, and I want to say everybody pretty much can share the same sentiment, but it's really important for, I guess, because we realize it is necessary, or maybe more so our responsibility to make others realize how important Black men are, right? To community, to their household, to their children, to their significant others, to the world at large, right? And I mean, for me personally, I think I am just tasked with being the mouthpiece for that, you know? Making sure I uplift other Black men, uplift myself, and giving light in information, knowledge, and support to other people who wanna follow, and not follow, but who want to do the same thing that I'm doing. You know what I'm saying? Want to lift up the work as well. So yeah, that's my 2 cents. Thank y'all for letting me share.
Right, there's got to be a voice to put out the ideas, and people can follow that voice. Thank you, Daryl. Anybody else? We still have some time remaining at 2:12 Central Standard Time.
Sure, yeah. One thing I like to add is I like the blend that we have in this space tonight, today, where we have folks from academia, and we also have practitioners. And so we get to hear from the academia what they're seeing, but we also get to hear from the practitioners, like, this is what we're seeing, this is what we're working on. And I think the most important voice of all, Latrice talked about earlier, we had the father panel where we actually got to hear from dads and say, this was what it was like when I was in the delivery room. This is what it was like when I was at the clinic. This is what it was like when I was at home with my wife, with my child's mother, when this was going on. And then we're able to hear from academia talk about, well, this is what we're seeing in general across the field. And then practitioners, they help us to localize it and see what's going on in our individual community. So I love the beauty of it, the synergy of it. And I think the more we have these conversations, like Oliver Thomas was mentioning, I think it helps to spark that change in those dads, that one dad at a time. So that's what I liked about this whole conversation about the systems level change, that we got to see all these different levels of systems in action in our space today.
I'd like to add one last thing. Black people are so frustrated by, as an elected official, people are frustrated. I know they have the right to be, But even before that, in spaces, I hear folks say they're tired of meeting, they're tired of getting together, they're tired of having dialogue. Well, that's crazy. We don't dialogue enough. We don't get together enough. We don't release enough. So we're even being conditioned to believe we don't need to get together and talk. Sometimes that conversation is the only relief that you have. Sometimes being in a room with like-minded people who care about the same thing, even if they haven't changed it, their collective energy actually chips at that system. It chips at that problem. So I would say, man, conversations and talking to each other, even if we're challenged by the fact that we've been talking about it for decades, those conversations are healthy, because you are impacting that, whatever that stereotype or whatever that issue is, or you're building on a foundation when you do that. So, let's kind of, and I'm hearing people say that more and more often, man, I'm tired of meeting. Well, okay, I'm tired of talking about it. Okay, well, maybe we'll luck up and do something in that conversation, in that meeting at some point. So I'd like to see us start to chip at that. Thank you.
Thank you, Council Member Thomas. What you said just made me think of something that Latrice had mentioned. Latrice Collins had mentioned. Latrice, if I got your last name wrong, I apologize. But she talked about the opportunity that COVID and with the emergence of Zoom has allowed us to do. So it makes me think of controlling the controllables. So what do we do when we have to separate this conference is an engaging opportunity to continue to do the action of communication with one another. So once again, to Bantu's point, this is a great opportunity for us to advance forward using Zoom meeting and scheduling behind the scenes of putting things together. Everybody at COA has put their thoughts going into it, and we just continue to roll forward. So this communication experience is a great opportunity. Anybody else?
Sure, I'm sorry.
Oh, no, it's fine.
This is Robin at March of Dimes. I just wanted to share that this has been great today. I've really appreciated being able to listen in. I am one of those well-meaning white women. And so I just wanted to say that it's so important, I think, to center melanated voices in this work. And I love the idea of the Birth Story Project for men. And I will be contacting Bantu, and I've just joined Fathers Matter, the group. So I'll be more present in the father arena thanks to this conversation. So I appreciate you guys.
All right, thank you. We appreciate you as well. All right. So again, the question is, what is one small thing you could do to address a current challenge with the resources and authority that you have right now?
Well, I'll go. My name is Dawn Collins. I'm a doula. I'm not in New Orleans. I'm actually in Shreveport, Bossier area. The way that I came to be a part of this today is because there was the flyer. I actually got invited. I know about Fathers Matter because of Dr. Bantu there, because of my doula training that I received with Sister Midwife Productions. The thing that I can do through my business and just in the birth work here is just that connectivity we were talking about, the networking that we were talking about. I'm a part of a few different committees and boards out here in this area. And yeah, so what I'll continue to do is spread the word, but while I'm spreading the word about birth work, I will emphasize dads. And the thing about it is during my training, what got my attention about fathers was a session with Dr. Bantu. And what he mentioned was his journey with his children during the pregnancies and how he was treated and his thoughts. And what actually happened during that session for me was that I remembered my husband experiencing what I didn't know then, but was able to label and name after this session for my husband and myself, was that he was experiencing postpartum too. I did not realize that. Our children are now 25, she'll be 26 in May, 22 and 18. So I have pretty much, they're grown at this point. But it took me that long to realize that men experience postpartum, something as simple as that. That was my aha moment where I was like, you know what? This is ridiculous. These men have been here the whole time and we've been pushing them out. No wonder there's all this disconnect through this process. And so I actually, I'm going to be honest and transparent. After that session, I went to my husband. I asked if he remembered this particular incident that happened between us. He said yes, and I apologized to him. What it was that our baby, she was just 6 or 7 weeks old, had gone back to work way too early. And he was working days. Well, no, he was working mids. I was working days. He was watching her during the day. He was in the military, brand new to the military. I came home for lunch and I heard my baby crying outside the door. She was in a playpen. She had rolled over on her stomach, or he placed her on her stomach, and she had made her way up into the corner screaming. I walk in. I don't see him anywhere. I don't know where he is. I pick up the baby, calm her down. He comes out of the bathroom and he's just looking at me. I proceed to go off, like completely off on this man. And he, normally, if there's any disagreement, my husband, if I get a certain octave, and gentlemen, you can probably relate. If I get a certain octave, he'll either tell me we'll talk later, or he'll walk away and I'm standing there talking to Mr. Elf. So, but this time he was standing there just looking at me, and he let me say everything I needed to say, or I felt I needed to say. And at that day, I quit my job. I said, I'm not working. Obviously, you can't take care of this baby. But I did not consider that he was going through postpartum. I didn't consider the weight of being new in the military, having 2 kids, because I was a single mom before he and I got married. So this is our second child. We were very young, very young. We were 20, in our early 20s. And he had never really babysat. So he hadn't really been around kids. So parenting wasn't his thing. He comes from a divorced family, you know, all of that. And then I have my own issues over here, as you all mentioned at the top. Fathers are sons. Well, you know, daughters are mothers are daughters too. And so we all came with our stuff. It took years with Dr. Bantu's help to realize that at that moment, with all those pressures on him, that was postpartum. He didn't mean any harm. He did what he could do to survive, which was go to the restroom while that baby was screaming. And then he probably was going to pick her up and go to sleep if he could, but he was tired. All I could think about was you don't know what you're doing. And this is what happens a lot with dads. You don't know what you're doing. You can't handle this. So I tell that story to my clients. And then I also tell them about Fathers Matter, and I try to get them to connect, because there's not an actual Fathers Matter type program out here this way. Hopefully one of the dads will create it and connect with you. But yeah, so that's what I do. And I share that story wherever I go, to whatever community, board, or committee I'm a part of, to try and bring out the fact that fathers really are experiencing this pregnancy just as much as the mother. They're going through each and every stage, and each and every stage carries emotion, and we carry all this emotion in our bodies. So I'm sorry to take up so much time, but that's what I'll be doing and continue to do and help other people. I appreciate the invite. Thank you so very much.
Dawn, thank you very much. holding it down. And is that Bossier Parish out there? Shreveport and Bossier. Gotcha. Thank you so much for sharing that. And it just speaks to the need for a program like Fathers Matters and all the different areas that are represented here. Just scrolling back through the chat, I see a lot of support for what you were speaking about, Robin, and so from Councilmember Oliver Thomas and Greg David as well. So Armand Perry said, answering the question, what can we each do to support fathers? Encourage and affirm those around you to take on roles that are both traditional and non-traditional. Greg David, I got the pronunciation right now. I'm sure.
I'm fine, brother. You know that. I'm proud military, so I got to answer to all of it.
Oh, good. I got you. Did you want to elaborate on the PowerPoint that you created about postpartum, which is
that was definitely one of the aspects of that a lot of our men did not understand or didn't realize that they were dealing with postpartum as well. And like I said, it's tough enough that, like say it's for mom, but a lot of the moms don't realize what the symptoms are when it's concerning that. So when Don mentioned that part about him just signing off, that's basically what he did. He signed off, right. Because his brain, he didn't know what was going on. He could feed the baby, he could change the baby, he could do those things, but to stop the baby from crying, all they tell you is like they're wet or they're hungry. But he couldn't concept that. And that's in dealing with postpartum, you just disconnect from that. And that was some of the things that we focus with a lot of our dads. And a lot of our dads, when they go dealing with postpartum, that's usually when the separation between the moms take place. Because they disassociated themselves from what was really going on. Yeah, they knew I'm a dad, I'm happy, I got a son, I got a daughter. But then after that, that's all they know. That's it.
Yeah.
And with other things that pile on, and we talked about ACEs, which we didn't, at that point, we didn't realize that was a big factor with it. But once they separate from that, they figure, okay, I'm too proud now. I'm not going to go back and I can't apologize. I can't go back and tell them I'm sorry. So they stay the hard role and they basically just go on about their ways. So, but I do have a PowerPoint that I have and I'm willing to share. Unfortunately, I have to run. My daughter texts and say she's getting off early, so I got to go get her. But I'll put my information in the chat. And if you guys need it, just shoot me an email and I'll send it over to you guys.
Hey, Greg DeVee, this is Ronnie over here on the tech side. If you don't mind, if you email it to me, I can put it in the share folder and we're going to share a link so everybody have access to any resources that the speakers, presenters wanted to share. It'll all be in one folder for them to just go in there and grab, and they'll be able to reference it whenever they need it.
Perfect. Thank you, brother.
Right. Thank you.
That's awesome. Thank you, Greg. All right, so at this time it's 2:27. I know that we were, check out the chat, hang on one second. So moving on, looking back at the chat, appreciate y'all patience. Let's see, Shedron Burnside says, celebrate, uplift, and acknowledge men and fathers. The narrative only changes when we tell our own stories. Would you like to speak to that, Shedra?
Yeah, just what I said. I think I really appreciated hearing in the panel, about dads and the impact of dads on your life. And then I know, I can celebrate my dad all day long. And I say this in our circles. I believe my kids got to the point where they are, 2 adult kids, and because of my husband and his relationship with the kids and his involvement in their primary years. And so celebrating those stories, acknowledging what's happening. It's easy to acknowledge the negatives and blow out of proportion. The one story that OT said, we never can live down, but until we start sharing the narratives and celebrating what's going on, then that's going to stay the same. And so that's all. I would just say, lift it up, celebrate as often as possible, and tell your truths, right? I like to say I learned from my dad, if nobody else, to love people for all that they are and all that they are not. And that wasn't because, you know, of who he was, it was how he treated people, right? Like, he demonstrated that he was the most forgiving person that I know on the planet. And so he modeled that behavior. And so, yeah, celebrating, acknowledging early and often is the only way we're going to change the narrative.
Thank you so much. Anybody else would like to add to that? David Filkins in the chat, he said he's stepping away, going to the bathroom may have saved the baby from abuse, reflecting back on the previous conversation. All right. Well, it's 2:29, and before we end, does anyone have any questions? I know the information is going to be shared through a link to everyone who was able to be a part of this wonderful conference. But does anybody have any questions or final comments? So Bantu, if you would like to share anything before we wrap up.
Yeah, I don't mind sharing some closing comments. And I know we have a survey link, so if we could drop that in the chat for everyone to take part in, I would appreciate that.
Yes.
And so just reflecting on today's conference, from where we started to where we are now, I think one of the things that I walk away with from this conference is that Black fathers don't need to be rescued. We need to be recognized. That you see these very intelligent Black fathers on the line, these very intelligent Black fathers doing their research, like Dr. Armand Perry. Then you have these very intelligent Black mothers who are married to very great Black fathers, and Dr. Latrice Rollins. And so we're here, we're doing the work, and it's evident. I think it's very clear. And so I think the more recognition that we get of doing the work, and as I mentioned earlier, that there is that narrative of, the dad being aloof and out of touch. I call him Homer Simpson, but in actuality, I see a lot of Black dads who are actually doing the job. And I think one of my favorite lines I heard was, there's this narrative that Black dads aren't there, but the Black dads who are doing the work don't pay attention to what they're saying. And so that's why there isn't much of a pushback. But I think now with the work that we're doing, myself, Daryl, and Shedrin, is that we're challenging that narrative, that master deficient narrative, as Dr. Alston pointed out earlier, that we see the dads in the communities doing the work. And even as Bob said in one of our sessions, is that the data doesn't align with what we're seeing. So even though the mass narrative is saying, Black dads aren't doing this, they're not doing that, they're not in the homes, they're not doing this. Daryl, myself, and Shedrin, and all the other practitioners on the line are saying that it doesn't compute, it doesn't add up. 2 + 2 is 4. Why are you getting 5? It doesn't make sense. And so I'm glad that we're able to have this conversation today to reconcile some of those things. And I think I'm preaching to the choir when we talk about this. And so it's so good just to be in this place where we know that we're doing the work and we're pushing it forward, and that we're having this community conversation. And I think another piece to add into that is that we have individuals from Georgia, from Louisville, in New Orleans, and yet we're all singing the same song. I was just joking with a colleague of mine not too long ago. She was like, yeah, I did. And what kind of music did y'all listen to? And she's like, yeah, we listened to that too. And when you guys, did y'all have a lake, and did everybody park the car? And I was like, yeah, we did too. And so I think it's interesting and fascinating that we're all saying, yeah, me too. We're saying the same thing when we talk about fatherhood. Yeah. And so I think, systems level change can be pretty simple across the board. It's just a matter of continuing to doing the work. And then we also have to recognize that as we're doing the work, we know that there'll be pushback. And so we have to be smart about how do we get on the offense when the pushback does come, how do we play defense? We know that there has to be strategy. that it isn't just going to be, they're going to, you know, open the doors and allow us in, even though we wish it would be that way. But so we have to be smart about it. We have to strategize about it. And I think the fact that we're all seeing the same things, that we can be smart about it, that we can be in communication with one another. So I'm grateful for being a part of this, hearing the dads actually speak into the space and say what they're seeing. It's so amazing. I know even when I tell my story that I didn't realize my story will resonate so much with Dawn, because it was, you know, maybe a Tuesday evening, you know, I'm just talking about, you know, my experience, and Dawn goes to her husband and apologizes. I'm sure he's like, where did that come from? And that was this life altering moment, you know, for him, for their family. And so I think the more that, you know, we encourage and educate fathers, it'll be better for the family, because I do believe, you know, it's not a competition, but Black fathers are a great advocate for their family. They're a great advocate for that, especially in the birthing room. When a mom is giving birth, she's in this very, you know, innocent stage, you know, vulnerable state, where, you know, she's being asked to push. Do you need more drugs? What are you going to name the baby? And dad is right there, and he's being ignored because he needs to hold the iPhone to take pictures. But I know for myself, I was like, no, sir, like, I'm right here. Like, I think she needs a little bit more Pitocin. I think the charts are telling me something's going on with the baby's heart. Something's going on with her heart. And I think we need to empower dads. So I'm grateful for dads like Jared Baptiste, who's actually in the medical field, who can speak to those doctors and speak their language. And all of a sudden they have to respect them in that room. Because I think there is a lack of respect at times for dads when they're in the space. And so as we begin to speak up and show up in these spaces, that respect will be given, and that they will begin to pay more attention to us. Because again, we don't need to be rescued. We just need to be recognized. And so thank you all for coming out and participating in this event. It's been great. I hope we can continue this conversation, and maybe we'll do this again next year. So with that, I will say good evening.
Thank you. All right, so is that a close for the entire event, or?
Yeah, let that man look. Just close up. I just got one last word. I just want to thank everybody for coming, staying till the very end. And I also want to reiterate that Fathers Matters will be resuming our dad discussions. That's that weekly sit down roundtable that we do on the 31st. The flyer will be in the shared folder that Brother Ronnie put in the chat. So feel free to look at that. The registration link is real simple. It's a bit.ly. And I just want to say that I appreciate everyone giving their time, their energy, and some space to today. And I hope to see you all in the next conversation. That's all I got.
All right, thank you, Daryl. Well, y'all have a wonderful time. Make sure you fill out that survey that's dropped there. It's a Google Form survey, event evaluation, and takeaways for that. It's right there in the chat. Well, y'all have a wonderful day. God bless you.